10 ஆயிடுச்சுங்கம்மா. அவர் ரெடியாக இருப்பாங்களா? நீங்கள் ஏதோ சேர் போட்டுருக்காருங்க. Start பண்ணலாமா? Good morning, everybody. Thank you very much for listening to me yesterday. We have covered 1/4 of the topics given to us. So let us start with a good domain. So just recollecting what we have told yesterday, it is about the healthcare system in India and the aim was health for all. So we talked about government setup where the smallest unit starts with the dispensary, and this dispensary caters for 3,000 population, and it will be in the village, and it is manned by one ANM, healthcare worker male, and another healthcare worker female. And they have got their own functionality. ANM, the very purpose of planting this dispensary at this level is to deliver the children and take care of the pregnant women. It is called MCH, Mother Child Health. And apart from that, they also give first aid for smaller ailments, and they are the first people to diagnose and refer to the proper institution or to the higher center, is called PHC. This primary health care center is situated where it caters for 15,000 people, triple the dispensary, and first time the medical officer will be there in the C2, one male and one female doctors, and teamed with nurse, pharmacist, and paramedical workers. Paramedical workers, and again they will be monitoring the dispensary, and dispensary people should report to doctor who is in PSC, and PSC has got double responsibility. It is preventive as well as curative. So rehabilitation will not be there, and preventive is that it is immunization for all kinds of diseases, and also again taking care of smaller ailment which cannot be handled at dispensary level. And they will also have small lab where preliminary tests can be done to make a diagnosis, and if possible they treat there, and otherwise they will refer to the higher center. The higher center for PSC is CHC, Community Health Center. It is usually for 1.5 lakhs population, and in Pondicherry we have got two. One is Karikilambakam and another is Manadipet, and outer region we have got same CSC in Mahe. And here there is a small operation theater where small surgical ailments are treated with surgery, and it is also having a physician who diagnose, treat many of the diseases. It is just small hospital, and it is backed up by lab, pharmacy, physiotherapy, and other paramedical workers who also carry out the preventive aspect of the health system. Afterwards, as we know already, it is a district hospital, state hospital, and specialty hospital, and super specialty hospital. In super specialty hospital, usually prevalent is urology, nephrology, cosmetology, and then it is cardiothoracic section, and where cardiac operations are done. And apart from that, it is backed up by many super specialty in orthopedics, and it is backed up by the physiotherapy. Apart from that, we have got All India Institute of Medical Sciences, and there are so many All India Institute of Medical Sciences. It is not only for services but also for research. And the biggest aims is in Delhi and Chandigarh, where post-graduation studies are given, and also super specialty like MCH and DM is conducted. So it is only brief introduction to this. Apart from that, you have to understand one thing: government supports health only few hours of the day. Rest of the period, say about 18 hours of the day, the say private sector takes over, and private sectors may be nursing home, it may be corporate hospitals in big cities where all the facilities are available, but patient has to pay, and most of them will have insurance, and very easy for them to get super specialty services. So apart from that, one thing we always forget about the employee state insurance. It is for laborers, any sector, even a small sector, shops where the workers are there, factories, mill, all these people will come under ESI. They will have different setup, and every region consisting of about 2,000 people, 3,000 people, one dispensary will be there, And in dispensary, there is both preventive and curative services like any other dispensary. Apart from that, they usually diagnose cases and refer to the hospital. ESI hospitals will be there. Yes, here in Pondicherry, ESI hospital is there in Indiranagar, and there they will decide the mode of treatment. If it is beyond their scope, they will refer to higher center like Chennai for us, and most of the health is covered by that insurance. And the laborer or employee will get leave according to the ailment, and it also covers the whole family. So another entity which is just gearing up is Ayush. This Ayush has got 5 components: Ayurveda, Yoga, Unani, Siddha, and Homeopathy. This, according to these units are there in all PSCs according to the liking of the population of the tillage. They may opt for Ayurveda, they may opt for Siddha. Here, most of the dispensaries they will have Ayurveda, Siddha, and Homeopathy. And this yoga and naturopathy is situated only in Pondicherry, where director of Ayush is there. That is the one which is giving lot of coverage, because it does not involve drugs. It involves only naturopathy, means the medicine is through the food, and other things, ailments are controlled by autonomic nervous system, that is yoga and meditation. And these seasonal fruits, seasonal vegetables, and that should not be traveled for a longer time. And it maintains the minerals and the vitamins, and thereby pH of the body is maintained at 7.4, and person will not having any diseases. Even people who have got diseases, that can be treated by naturopathy. And this is taken in a very war footing, and everybody likes it. Why I am telling this, does not need any degree. Only thing, the basics has to be understood. So how much proteins has to be taken, how much carbohydrate, how much fat, and macronutrients, micronutrients, and how much of waste we have to generate. For example, if a person passes 750 grams of stool, they will not have any digestive problems. And if he passes 1 liter of urine with slightly yellow color, that means he can certify himself as he has got sound health. So this is what we are trying to educate the community, so that they can
Hello, sir. You're not audible right now, sir.
Sorry for the interruption. This is a internet problem. So let us proceed. That after Ayush, we have got NGOs, especially Rotary and Lion, and their contribution is very much for the health, especially a polio eradication. Rotary International helped us a lot. Because of them, today we got a certificate of eradication of polio. They usually conduct camps, medical camps, where they detect some diseases, refer to the hospital. Thereby, the people who are far away from the health facilities, they'll get that opportunity. Doctors, lab, everybody goes to the camp. They detect the ailments, especially surgical ailment like is hernia, hydrocele, piles, appendicitis. All these things are detected there. It will be referred to a particular department, and they get treatment there. So this is very much helpful to us, because the health sectors cannot go interior, and that is beyond 3,000 population, and they have to walk to the center. Here, the health goes to their doorsteps, and they will detect first time. Many cardiac ailments are diagnosed, and lot of children, especially age group of 5 to 10, their lives are saved, because in early diagnosis is very important in medical. Early diagnosis, early referral, and treatment part. We have got lot of centers, and so many philanthropic hospitals are there. They are doing even free surgeries. So again, coming back to briefing about the institutional setup, I already told you the eye of the institution is OPD, where all the people from all the categories, they come to seek health care, and they go to the different departments, and that will be segregated at the reception itself. And surgery, medicine, then ENT, eye, dental, psychiatry, and more important is pediatric, super specialty like cardiology, nephrology, neurology, and plastic surgery, ENT, ophthalmology, skin, and ortho. So these are all the usual departments, and they go to the particular department, and that will be segregated at the reception. They have to go to the preliminary doctor. He examines, and then it refers to the chief of the unit. Chief of the unit decides whether they have to get only OPD treatment, or they have to be admitted as inpatient. Once they get admitted, they will be investigated with so many other facilities, and the final diagnosis, whether it has to be operated, whether only medicines are enough, or only physiotherapy, or any modality, they will decide in a day, and the inpatient will be there for 5 to 6 days. By the time they get final diagnosis and also remedy for the disease, and they will be discharged, asking them to come periodically for checkup. This is usual OPD anywhere. This is the working pattern. And apart from that, there is casualty 24 hours round the clock, 7 days in a week, and 365 days in a year, and it runs in 3 shifts, 8 to 2, 2 to 8, and 8 to 8. It is manned by 2 basic doctors and supported by pharmacists, nurses, and technicians in the same region. And apart from treating the patients, it has got another responsibility, as I told you already, which is not much covered, is medico-legal aspects. Medico-legal aspects where police intervention is there. That is due to suicides, attempted suicide, attempted hanging, attempted poisoning, and then the road traffic accidents are the major one. Once they come, it has to be registered, and thorough examination has to be done, and then treatment has to be given if it is a small island, and it has to be intimated to the police. In case of severe injuries, patient is admitted, and the police come and investigate, and further procedures will take place. In case of death, after few days of admission, it will be subjected for postmortem, where final diagnosis will be given whether it is suicide, homicide, or accidental. So it depends upon the cases, and the modality of death and cause of death has to be given by forensic doctors after the postmortem is done. This final diagnosis is very important because in case of insurance, they need final diagnosis and it should be authenticated, because people should be aware of this. Otherwise, what happens, like any other cities, they come and demand the discharge in off the way, or in case of death, they want to take the body forcefully by beating the doctors, nurses, paramedicals, and it is all happening. Only last week it has happened in Kerala also. And in that case, responsibility also lies with us to tell them death certificate is very important for burial as well as for claiming insurance for any further future property dispute and other things. So that postmortem result and also the final diagnosis is important. Even if he is admitted in halfway, he should not go away. If he goes away, the certificate will not be given, and that comes under AMC, that is against medical advice. So this again puts them into problem. So when you take the victim from the accident area, you must be able to identify yourself and just tell the facts, what has happened. That will be taken in the accident register, and you will not be put into trouble, because only once the police will come and inquire where you found the victim, what was the time, what was the day, what was the month, only preliminary things they will ask. If you answer, you are free. And because of these accident cases, many people will not come to the help of the victim. Very important time is lost and he may lose his life. So by helping the accident victim is not a big crime for you. It is only thing you have to know your rights and responsibility. Responsibility is that you must be able to tell them where you have seen the victim, so what was the condition, when you brought to the hospital, and time, date, month, and year. That's all they require from you. So this is again, it has to be circulated into the community. Many accident cases nobody will take because they think police will trouble you and all. But it is your responsibility to save the life of a citizen, and their little trouble is that you have to be there with the victim till police come, they interrogate you and get some history. That's the end of it. And in casualty, so identification of the person by identification marks is important, and you are all very much interested in medical, and also you are already there in the health sectors. So identification marks of the person is very important. To black mole, or it is called ABM, or tattoo mark, or scar, or keloid, anything on the body, especially exposed parts of the body, has to be written at the accident site. Same should be submitted. That's how they identify the person when they admitted in casualty, and then they go to the particular ward, or in case of death, mortuary also. Your identification marks very important. That's how they identify the person. These are all important thing in the casualty. And casualty, they see all the emergency cases, not only accidents. It is any emergency, and they have got all the facilities in the casualty to identify the diagnosis as early as possible, and specialists will be called to the same arena, and services will be instituted as early as possible, especially in case of surgical emergencies, medical emergencies like the heart attack, where they have to take ECG. Any chest pain, ECG has to be taken. It will be taken in few minutes, and this interpreted in another 5 minutes. And if the treatment is given within 1 hour, most of the cases can be saved. Why most of the cases? All cases can be saved. So it is, you have to understand that casualty has got lot of responsibility. People who are manning should also know how to maintain the registers, what is wound certificate, what is police intimation, what is injury certificate, whom to give the injury certificate, and writing identification marks on the wound certificate. This will go to the court after few months. Again, the doctor who has seen the patient has to go to the court, identify the person, and give all the questions asked by the prosecutor as well as defending lawyer. They will ask same questions. When you have seen, what was the time, what was the condition of the patient. So condition of patient is written, and what was the first aid given, where you are referred, what was the preliminary examination. So this heart problem usually comes in the midnight or early hours of the morning, and no facilities will be available anywhere. Usually such persons are brought to casualty, and with one ECG they will make a diagnosis, and the treatment is very easy. It is a tablet or one injection, prevents massive heart attack, and you will be on the road in 6 weeks. Why I am telling you, though it is a purely medical aspect, and the public should know, and especially medical people like you should know what the facilities available in the casualty. So from there it goes to the ward. So it is according to the ward. If there is a case of stroke, for example, it straight away goes to neurology department. In case of head injuries, where surgery has to be taken place, it goes to neurosurgery. In case of damage or injury to the ear, nose, or throat, it goes to the ENT mostly, and many cases will come with accidents, many fractures. So orthopedician, person who deals with bones and joints, will take over, and specialties are available in almost all the general hospital, and casualty is the one which segregates the cases, identifies the cases, and send it to them. And one more thing we have to remember about health setup is physiotherapy. This physiotherapy is very important aspect of the hospital, where they prevent the diseases, cure the diseases, and they prevent the recurrences. Say for example, a person has got neck pain. It is called cervical spondylosis. They take one X-ray, right? They diagnose, they give the particular physiotherapy to the muscles by side of the vertebral column, relaxes the spasm of the muscle, pain is gone. Then they will teach how to keep the neck, how to use the neck, and how to prevent further painful cervical spondylosis. Same with back pain, and also they are the people who prevent many complications after surgery. This is called post-operative physiotherapy, where it is vastly increased, and they prevent many things after surgery, and their tone of the abdomen, their tone of the pelvic muscles will come back, and lot of misery can be prevented. And this physiotherapy is also very important after all the surgeries, where they have to get the muscle tone back, and recovery on the road should be faster, especially after cardiac surgery, bypass surgery, and physiotherapists are the sole things which make you to walk within 48 hours. And once you start walking, and you are discharged from the hospital as early as possible. That is the aim of the corporate hospital today. You are operated next day morning or yesterday evening, you will be discharged. Only help of the physiotherapist. They give active as well as passive exercises, make you fit for your work, for your life. And this physiotherapy is very important in case of sports medicine, where they are closest to the sports person. In case of injury, they identify the injury, they refer the injuries to the particular thing, and they also give physiotherapy in national and international arena. They put the player back onto the ground very next day. So it has developed very well, and this department is most important in medicine, where recovery will be faster. recovery is very important, because earlier we used to keep the patient 10 days, 12 days in the hospital after operation, after injuries. Now with physiotherapy, we are able to discharge them in few days, so that the hospital infection will come down, stay will come down, cost of the surgery will also come down. So physiotherapists have got different modalities, how they can make patient recover their ailment, and there is all sorts of things are available, especially for people who have got paralysis. Paralysis of one side means only few fibers or particular group of muscles are weakened. The rest of the muscles are called untapped muscles, which are already there in the muscle pack. So he is going to stimulate the unused muscle, make you walk, make you talk, and make you work as early as possible. So in all countries, especially sports arena, sports medicine, physiotherapy is the kingpin, and whether it's a cricket, international cricket players, football players who are paid so much, they come under insurance, and physiotherapist is the only medical person who is close to the team and who can run onto the ground and identify. No doctors are allowed there. Only when physiotherapist needs orthopedic surgeons help, he will refer. So physiotherapy, so people outside, they may not know the importance of that, and it supports to the recovery of all ailments. There is nothing like it cannot do today, and that department is well developed in all the hospitals, and you have to identify, and reference is very important. And when you go there, you have to ask physiotherapist the modality of physiotherapy, and if you got any queries, you have to pose it before taking physiotherapy, because if your knowledge is bit high, then it is, you know whether the modality given to you is correct or not. You can even direct physiotherapist that this is the particular profession where recovery needs to be faster, and they've got other modality to use. Otherwise, usually routine way they go, and the recovery may be less. So why I am telling you this, you not only have got rights but also responsibility of knowing the things. Apart from physiotherapy, we already told that there are other departments, especially pharmacy, where drugs are distributed according to the prescription, but pharmacist has got lot of responsibility. We go into details of it later, and because I am telling what is the facilities available in big hospitals, and pharmacy division is very important, and pharmacy division usually works according to the needs of last 3 years ailments, their needs and their demand, plus 15% more of the surplus population, and then they calculate for the requirement, and they procure, store, dispense, and take care of the expiry date. This small responsibility. So pharmacy's responsibility is, first thing, they have to talk to the patient before dispensing to the patient. They have to make sure that prescription belongs to the patient. You cannot give health education to the person who is collecting the drugs, is not a patient. Patient education is different. Family education in pharmacy is different. They are not one and the same. Family is a supportive member. He has to be enlightened when to give the drugs, what is the significance of giving this drug, how long it has to be given, and then whether the drug has to be given during taking of the food or before or after, what the consequences, and if the antibiotics are stopped in between, what will happen, that resistance. So you should not take it for granted. The patient does not need to know all these things. Unless he knows it, now we are already backed up with so many resistant bacteria, so many resistant, especially tuberculosis. It comes back with vengeance. I tell you the small story about the tuberculosis, why it is coming back. This is because tuberculosis, now we are giving the treatment at the doorsteps. It is called dot treatment. So we go there, ANM goes there, give all the 4 drugs and put it into his mouth and pour water, and she has to wait till he engulfs it. So in between, what happens, if the patient is not taking drugs properly, he spit it outside, so resistance may come. Second thing you must understand is that if the drugs are not taken for a particular duration, then again the bacteria will get resistant to the. So smaller things like that, what you people has to monitor at your center is that when the diagnosis is made on the basis of presence of bacilli in the sputum. So the person must be able to collect the sputum in right way. Sputum is to be collected in the early hours of the morning by tapping the back of the body, and so that you can get collected the sputum in layman language, and that sputum should be thick, and early hours of the morning only that will contain bacilli. So what happens now is the thing you have to understand, because tomorrow you are going to be monitoring the system, is that when sputum collection, a doctor says after examining his lungs that he has got a cavity and he may be having tuberculosis, So to arouse that doubt, he asked the nurse to give sputum for AFB, acid fast bacilli, tubercle bacilli. She knows what is tubercle bacilli. What happens in the setup like big hospital, this instruction will be given to the student nurse who collects the sputum in the morning, and that student, if he happens to be second year or first year, so she will invariably tell the old man giving the sputum cup, saying that Yache kudunge, give your saliva. So that old man who has got tuberculosis, who can spread tuberculosis not only to the family, to the community, he takes the saliva and gives it in the sputum cup. This goes to the lab, and lab will invariably report this as there is no AFB, means he does not have tuberculosis. He will be discharged and he will infect the community. This is one part. Second part, sputum is collected properly with all the precautions and dispatched to the lab. So in the lab, if the sputum is kept for a longer time, it may not get stained, or if the stain, which is particularly Ziel-Nielsen stain, whatever stain they do use it, if it is collected for a longer time, that loses its potency and it will not stain the bacilli. They invariably report it negative. So these are all small things, but all the small things in community and health is very important things we always forget. We know what is tuberculosis, what is cavity, what is sputum, why 5,000 bacilli must be there in 1 cc of sputum to be positive. We know how to stain it. We know how to look into the mirror, a microscope, and diagnose. But people working under us, nurses, lab technicians, and the persons who carry the sputum and bring back the sputum, they are the most important people in that. That's why root level medical team is very important. ANM, if you teach ANM how to conduct the delivery, how to identify the risk factor, the morbidity, mortality will come down. Maternal mortality will come down. Neonatal mortality will come down. That is the root level education is very important. For that, again I repeat, we have to conduct CME program, that is continuous medical education program for doctors, CNE, continuous nursing education program for nurses, and CPE, continuous pharmacy education, like that for group D, There is education how to sweep the hospital, how to clean, how to put the antiseptics, how to clean the instrument, how to collect the waste. If that group doesn't know, he will sweep from toilet to the corridor, infection will come into the corridor and into the wards. So we think it is all small things. We should not talk in this platform. These smaller things are very, very important where you are going to manage the healthcare system. So how to sweep, how to dilute the disinfectant, how to swab it, and how to collect the waste, where to collect it, how to segregate, and after segregating whether it is infective, non-infective, and people these things, it has to go in particular bags to the center where it will be collected by LED department and disposal is done properly. If the collection site is not good, not done properly, these mixes up. Say, for example, 10 kgs of non-infected material is there and 5 kgs of infected material. If the person who is segregating does not know it is infected, he puts into this bank, the whole 10 kgs will become infected. Again, I repeat, all small things are very important. Rest of the things you always get it in books, journals, and internet information is there. When you go to the hospital, whether you are a pharmacist, physiotherapist, nurse, this is the basic things you have to know to monitor and get work done and maintain the quality. Thereby, infection rate will come down. We are all there to bring down the infection rate. That is very important. Otherwise, whole hospital we have to disinfect little later. Apart from this, the education of the group D, where there are sanitary assistants, ward attender, theater attender, and the other people like malaria, filaria, leprosy. These are all the department clubbed with health. We forget, we think it is only a hospital which is catering the health. Malaria department, to quote, what is important is that mosquitoes are rampant. So we have to protect ourselves. If you can't protect, so mosquito bite will be there. Usually mosquito, female mosquito, which causes malaria, it usually bites in the night, right? And we have to protect ourselves. In case of fever, if you think it is because of malaria, remember we have to take a blood smear and identify what sort of malaria is that. There are 3 types of malaria, treatment changes, and mode of hospitalization also changes. Thereby, you have to protect yourself. So when there is a fever, where to report? It is a malaria department. It is always open, and they take the smear. Only those people can prepare the smear properly, and they will tell you whether it is a malaria or not. If it is malaria, this is the type of malaria, and drugs also will be given there itself. So it is awareness which is important. You admit the cases in general hospital, and if it happens to be malaria, we have to refer that case. We know the pattern of the temperature. Looking at the temperature pattern, we know it is malaria. Then we can take a smear. And again, I'll go back to the basics. And sorry for detailing this. Smear has to be taken only patient is having rigors and chills. That is the time most of the malarial parasite will be in the circulating blood. If you take blood when there is no fever, when there is no chills, when there is no rigors, you may get blood test negative. Again, I tell you, all smaller things are important things. We are all very superficial. We order to the lab technician to come and take the smear for what? Malaria. So we do not instruct them when to come and take it. We do not instruct nurses when to order the lab technician to come and take it. They come and take it ritually in the morning where there is no fever, there is no rigor, no chills. Malarial parasite will not be there in the peripheral blood, and it will be negative, and patient will suffer a long-term morbidity. like filaria, again the department which opens in the evening, and smear will be taken only after the midnight. No, because it's a biology that Culex mosquito comes only after 12 o'clock. And there is a biological connection between this vector and the parasite also. Once the body temperature goes down, blood temperature goes down, that is the time microfilaria comes into the picture from the lymph node. It will be swimming in the water. That is the only time this smear has to be taken. If the filaria is there, leg pain is there, swelling is there, lymph node enlargement is there, clinically it is filaria. But evidence based, if the smear is not positive, you cannot treat it. So take the smear in a proper time, that is only in the midnight. Filaria clinic usually opens after 11 o'clock night, and that time only the smear has to be sent. And smear, if it is positive, treatment can be given for 10 days. You can completely cure the disease. Otherwise, it becomes a permanent problem. The ordinary filaria become filariasis later, and nowadays we are not seeing that, because now the education is distinct out to the technician as well as the paramedics, and they are doing a very good job. But for your awareness, I am telling, blood test is not same. That is what we have to understand. When to give blood. Say fasting blood for sugar, for example. Fasting blood should be given minimum 10 hours gap. If you take food at 8 o'clock, it is 6 o'clock you have to give. Taking food at 11 o'clock night, going and giving the blood sugar, fasting sugar in the 6 o'clock, it makes a lot of difference. And you should not take anything in between these 10 hours. It is pure fasting blood sugar. Then they will give you the sugar water for next investigations. And when this filaria, malaria, which is rampant in Pondicherry because of mosquitoes, and leprosy, of course, is waning down. This comes from different bacilli. This leprosy bacilli is a very chronic bacilli, and he has to be exposed for a longer time. There must be a person in the house, or your contact should be for a longer time. It usually spreads by the nerves, and deformities are not existing nowadays. But earlier we used to see a lot of leprosy patients in Mission Street near the church. Now we have got a leprosarium. Patients are admitted, and rehabilitation and plastic surgery is done. Because once they lose sensation of pain, they do not bother about it, and slowly it eats away the bones, muscle, and crippling will happen, deformity will happen. Everything can be prevented. That is what I am trying to tell. Everything is prevented, provided we identify them early stage, or even in later stages. It should be in right hand, and in right hand means right person who treats it, not a physical. This general physician, it has to go to leprologist, and they know the different ways of taking smear from the nerve, and they will institute the treatment properly. They follow it, and few leprosy patient following up is not this thing. It is at verge of eradication. It is under the control, and that we are waiting for the certificate. It takes little more time, because getting certification and eradication, when the disease is between person to person. If there is a vector like malaria, so we can eradicate malaria, mosquitoes, eradicate the disease. It is between two human beings. Very difficult to identify one infected one, non-infected one, and therefore it takes longer time. These are extra point. So people who call me here to talk about other things are already there with you. And especially another thing about the orthopedics is that there is remedy for all the ailments under the sun today. Whatever the fracture, whatever the dislocation, so it can be relocated and fixed. And fracture, there is intramedullary nailing. Only plaster of Paris is enough, but only it has to be reduced and put it in same line. So that is what the bone should be having its own shape, size, position, form, fixation, and protection. For that, POP is given. And then if it is a very disturbed fracture and we have to put a pin inside, it is called intramedullary nailing. And in old age, fractures of the neck of the femur is very common when they slip and fall down, and then for this foot is rotated. Usually it happens outside the bathroom or inside, and as early as possible they have to be mobilized to the particular center and they do fixation. It is only for 6 weeks. They will be as normal as before. And sports injuries, the injury we have to identify on the roadside. So wherever injury is there, there will be pain, and when you touch, pain increases, tenderness, there will be deformity, and there will be redness, and they cannot move the limb. So these 5 cardinal signs tells you there may be fracture. Then just put a newspaper underneath that, tie it, and put a cuff and collar or immobilize the limb, bring it to the doctor. They will just take an X-ray and they say what is the site of fracture, what is severity of the fracture. According to that, treatment will be given. Roadside itself, we can make a lot of amendments in case of fractures, dislocations, and it is only immobilization which is important. And apart from that, the cases which comes to the casualty, as I told you, is an emergency snake bite. Snake bites are very common in the early hours of the morning when you get up and step out of the house, and you may be stamping on that, and in the darkness when you go for natural call outside. And only precaution you have to take is that whenever there is a snake bite, just immobilize the vein by tying the tourniquet above the bite. But remember, the tourniquet must be tied only in the lower limb thigh. Only one bone is there. If you apply tourniquet in the leg, for example, there will be space between the two legs and poison may spread. And don't cut the bite side to let out the poison. Don't do that. It is not first aid actually. By doing that, poison will get enter into the system much earlier. And immobilize the tendon and just put the limb down. Don't elevate it, and take it to the primary care center where they give first aid and anti-venom injections are there, and we can prevent all deaths taken by the snake bites. And running should be avoided. If you run faster, the poison enters into the blood and circulation will be passed, and it will go to the target organs like neuromuscular junction, kidney, or even heart. So these are all things to be first aid, but also very important. These first aid classes will be taken by Red Cross Society of Pondicherry. They periodically conduct first aid training for people who are prone for this, and they will teach how to prevent complication happening by the injuries. Its injuries will not cause. It is a procedures. You don't know how to lift a patient. The patient is laying down on the roadside after accident. He is not able to move his upper limbs and lower limbs. He has got injury to the neck. Only 2 persons are there. You lift his neck. It leads to respiratory arrest. Patient may die. So how to move the patient from roadside to the primary care, and this is taught in the first aid classes. How to lift the patient, how to immobilize the patient, how to treat the patient at the roadside, and these are all very important things in medical services where a citizen is also taught first aid, and that prevents a lot of complication arising out of that. If there is a paraplegia, in the sense we will take up that in the next session. And first aid book is available everywhere. You can read. If you want to get acquainted with this, Red Cross Society is periodically conducting first aid with professionals, and you can approach health department where Red Cross Society headquarters is also there. It is manned by NGO, and there will be chairman, and the chairman is both medical or non-medical. Underneath him, the first aid team will be there. They will teach you how to take care of the victim, whether it's a burns, snake bite, hanging, drowning, accidents. So first aid is very important for fishermen community. The Pondicherry state has taken in war food to teach them first aid, especially during disasters. In disasters, it is a mass casualty. I have to prioritize which patient has to be given first preference, which has to be carried to the hospital, which can be treated at that. It has all happened. The history has told us a lot of things, especially when electrocution is there. In disaster management, earthquake, when the house collapses, the wires, electrical wires which touches the ground will also electrify. A lot of people have died getting into the house, how to diffuse it, and that is the management of disasters is another area is vastly improved, and the centers is there in Ahmedabad where disaster management college is there. They will teach you what to do. Especially, it is the time to quote one incident where we went for training in Ahmedabad, both Pakistan and India. Management team were 16 people, ministers, directors, and first thing they taught in case of disaster, especially earthquake, biological signals are very important. Biological signals means 24 hours before earthquake, all the snakes, all the frogs, all the crabs from the ground will come out to the surface. You know that there will be a tremor, there will be earthquake. 12 hours before, all the birds and flying birds will fly away from the trees and making lot of noise. And in the ocean, in like tsunami and all, waves are started. It started in the Pacific, it reaches the Bay of Bengal in few hours, and we can, knowing the biological signs, you come out of the houses, most of the people die because they are inside the house. If you come out of the house, the collapse of the house will kill the patient, and also electrocutions. These are all not included in our syllabus and topics, but I like you to know about these. These biological signals is also there in every area. Whenever there is earthquake or tremors or tsunami, these biological class birds and these reptiles will come out of their homes, making hell a lot of sounds. And people who are trained, you know that there may be earthquake in few hours or a maximum a day when they come out of the houses, and especially Indo-Pakistan area where it is prone for earthquakes. These ordinary persons, they know the signals of earthquake, and you remember that nobody has died in that area. People who are in the city, Ahmedabad, they died because they were inside the houses. House collapse. It leads to a lot of multiple injuries and causes death. Shall we take 5 minutes break? It is 5 minutes break for you. Kindly assemble again after 5 minutes. We can proceed. Thank you. Thank you for listening. Welcome back. So another aspect of health where prevention is the core. It is about school health. So where we catch disease when it is very young and easy to diagnose cases, because in school health it is mandatory that a child has to undergo medical checkup every year. We know what was the ailment last year, its prognosis, and also whether it is cured or recurrence has appeared. In school health, it is usually very important is the body weight. Whether child is growing according to age, the body weight is less. There are very few common causes. One of the commonest cause in children below 14 years, the weight loss is because of worms. All small things, once again, I repeat, because the child always walks in barefoot. Child, most of the time, they do not know the personal hygiene. They are not taken care properly. They use the same hands which they played couple of minutes ago, and infection goes underneath the nail bed and also from the foot. These are two usual things to which the worms will get into the body. Once worms goes into the body, some worms stays in duodenum, and it is called the ankylostomia duodenale. It will take the best food of the body, and child is taking food but he is not growing by weight according to his age. So another worm which goes through the foot is again a small worm which pierces the sole, enters the lymphatic system, enters the blood circulation, and goes to the lung, and then it goes back into the intestine, its home. It is one is long worm which is called ascariasis. It is also called round worm, and it will be invariably in the junction between small intestine and large intestine, where the best food is available, and it takes away chunk of your food, and the weight of the person is coming down. Another worm which I already told you is ankylostomia duodenale. It is also called hookworm, very prevalent in India. It is there in a best place called duodenum, and it sucks all the RBCs and takes away the RBC, takes only protein, and child will have protein deficiency problems. So the treatment part is the biggest part. That is, awareness is very important in parents, that one child has got some problem in the night, there is a itching or grinding the teeth, and he is not putting on weight according to his age and height. So you suspect worm, first thing we have to do, what worm is harboring. That is the simplest test we can do is stool examination. So responsibility here is that it is not one time. That is very important. The stool examination has to be done 3 days consecutively. Today, tomorrow, day after tomorrow, stool has to be given. And if the stool reports a worm, it is documented he has got particular worm infestation. This is easy. It is a healthcare worker who takes care of and do it. As a parent, your responsibility is there. Once worm is there inside, usually the doctors, paramedics prescribe a drug. The drug for both the worms, and they give one drug. And that drug is given, and it eliminates the intestinal worms. And now the gist of the talk is that what is eradication? It is a controlling the worms in the intestine. One tablet is enough. But remember, the cyst and ova and eggs are in different places. The first place is in the skin, underneath the skin. Second is in the lungs. Third one is in the intestine. What is the treatment you are given? Whether it is albendazole, mebendazole, whatever treatment, okay. Or earlier they used to give Decaris for roundworms, albendazole for hookworm, for complete eradication or control. Whatever the dose you are given, please, this first dose eliminates the ailment from the small intestine only. Then our responsibility is that same dose should be given next month, same date. That is very important. Today it happens to be 11th. If you give one tablet today, it has to be given next month 11th. That is June 11th. That takes away the lung parasites. Then again, same date, another month, July, same date, it eradicates the tissue worms. So, intestinal worms, lung worms, and tissue worms will be taken away from the body, and the same tablet should be used every year, same date and same month, till the child becomes 23 years. So, I repeat you once again, problem with health is that we always treat the patient symptomatically. He has got a worm, give a deworming. It takes care of. It won't take care of so easily, and the child will be playing in the same environment. Child will be eating the food in same methodology. Recurrence will be there. That recurrence should be right. So first, the family has to take responsibility. You have to advise the family, not allow the children to walk outside barefoot and wash his hands with soap and water and common sense every time it takes the, and night time especially, the finger will automatically go into the mouth when the worms are there, and that again reinfection takes place. So you take care of the child and we take care of the worms. The worms, the treatment is 3 months consecutively to eradicate the worms, eggs, and cysts from the body. But to prevent reinfection, every year same dose has to be given, same day and month, till the child grows 23 years. By that time he develops immunity for intestinal worms, and the intestinal army will be ready to take care of. Till that time it has to be given. Again, I'm telling you, it's small things, but very important message you have to carry. It is not that we have to do treatment. It is treatment for the ailment. To prevent it further recurrence and complication, we have to take care of this. And apart from school health, treating them, just look at the finger. Look at the finger. There will be some white patches. Means he is loaded with worms. One clinical findings. Look at the finger. Finger has got white patch on all the 4 fingers except thumb. It is worm infestation. So you need not have to go to medical college to learn all these things. It is a community medicine. One sign, it is an infection, worm infestation. It has to be treated. It has to be treated 3 consecutive months and every year till the intestinal immunity develops. There are so many other types of cells existing in the intestine. The intestine is a huge immunolocating existing in both large intestine and small intestine. Lot of bacteria, virus, protozoa, fungi is going through our food and water, and in children and school going children, and the immaturity of the immunity leads to all sorts of problems. Then comes another thing, child is eating well, stool is negative but losing weight. In India, it is childhood tuberculosis. They live in a room where 100 people are there. Cross ventilation is not there. infection is very much rampant, and when a child is taking food, not putting on weight, and he has got little upper respiratory tract infection, like sometimes sneezing, sometimes cough, sometimes breathing trouble, and investigate it for primary complex childhood tuberculosis. In school health, that is what we usually do. And when you take an X-ray, when you do Monto examination, Monto will be positive, and X-ray there will be some lymph nodes or hilar region, and there is a patch, small patch or hilar node, and Monto positive, 100% child has got tuberculosis, and this tuberculosis is called primary complex, and this helps us to identify a person in the family or nearby who has got open tuberculosis which has infected the child. So we can diagnose, we can control, we can eradicate the diseases by small things in school examination, where the doctor who goes to the school must know what are all the prevalent diseases in the region. Pondicherry is different, Yanam is different. You have to know the geographical distribution of the diseases, whereas you can make the bracket smaller and diagnosis will be easier. So primary complex is again is rampant in childhood, and only Monto and an X-ray chest, hilar lymph nodes present, Monto is present, and sometimes blood also, one drop of blood also will give lot of information. I will talk to you little later about that. One drop can clinch the diagnosis. It is only lymphocytes will be there. And to measure to the prognosis, we take blood for ESR, erythrosedimentary rate, and that will give you the prognosis. ESR is 36. Now after 1 month, it has become 18. That means the diagnosis is correct, treatment is correct, drugs are correct, dose is correct, mode of vision is correct. Or in case if the ESR is going up, that means your diagnosis to be revised, or treatment is wrong, treatment is correct, dosage is wrong, dosage is correct, the mode of drug is different. So this is what assessment is in community where primary care system PSC is there and child is studying in the school. It is attached with a doctor who goes to medical checkup. He has to know these smaller things. So once tuberculosis is there, there is a treatment. It is given for 6 months and the tuberculosis is gone forever. Otherwise, what happens? Sometimes the child in the night, he will not spit out the sputum. If the sputum is coming, he swallow the sputum, and repeated swallowing of the sputum produces intestinal tuberculosis. It goes and settles down at ileocecal junction, and the intestinal tuberculosis develop in the adults. It is called Cox abdomen. So if you know one, you will know another. It is very easy. It is only basics again. So the child is not treated properly, and he swallows the sputum in the night. He will not spit out even in daytime also. So when the night, acid will be less in the stomach. It bypasses the watchdog. Some children may land up with Cox abdomen or intestinal tuberculosis, very difficult to treat, and sometimes surgery is needed for that. So to prevent all these things, if you take little precaution in the school health, where you identify, it is only my mother will come and tell, "Ella saapidran, he has not put on the weight." This is the usual complaint in the school. Lot of things you can learn from this. Another thing is very important examination in school health is throat examination. Doesn't need any big instrument. All that you need is tongue depressor, a torch. Put a torch into the throat. Throat should be pink in color. There should not be any inflammation. It is a normal throat. If we find only 2 red lights, it is tonsillitis. The whole throat is red in color, it is pharyngitis. Now, what is importance of school health is that if you take care of the throat up to the age of 14, citizens will not have very deadly diseases. throat is the site for many diseases, especially rheumatic disease. From throat, it goes to the heart, and there will be a hole in the heart. It goes to the joint, produces joint problem. It goes to the kidney, produces kidney problem, and many more things. It goes to the lungs, produces lung diseases, goes to the heart, produces rheumatic heart disease. So throat is so important and so easy to examine, and all that you need is a torch and tongue depressor. Ask him to say, put tongue out, just compress it, throw the light. Two lights are there. Physiology, normally it should be pink in color. There should not be any red color. There should not be any pain. No pain when swallowing, no tenderness, and there is red color, it is pharyngitis. And only two lights are there, it is tonsillitis. And in that adenoids, sir, one question you can ask, you should ask leading question in school health. That is very important. You can prevent citizen become diseased person, diabetes, hypertension, right? Kidney disease, lung disease, heart disease, joint disease, bone disease, everything can be prevented by just taking care of the throat. So if it is tonsillitis, treatment has to be given, antibiotics has to be given, or at school health level, it should be referred to ENT, a person who takes care of ear, nose, and tongue. He will take care whether it is a tonsillitis or adenitis or pharyngitis, right? So in case of adenitis and tonsillitis, if you ask the question to the mother, what is his problem, why you have brought him, she immediately says, because you are asking a leading question, she says, Vayale moochu vidvan. He breathes through the mouth. Means his nose is blocked. It is 100%, it is tonsillitis, adenitis. Primary diagnosis, you need not have to be 100% diagnosed. So if it is, the swallowing is difficult. He has taken ice cream last week, today has developed sore throat and testes, ask him to drink water, he drinks with lot of difficulty. Difficulty swallowing is pharyngitis. Redness is pharyngitis. One symptom, one sign, 100% it is pharyngitis. Breathing through the nose, and there is enlargement of the tonsils by torch. What else you want? School health, and if you remove the tonsils or treat the tonsils, tomorrow you need not have to spend 1.5 lakhs to repair his hole. You will have stenosis, mitral stenosis, heart problem. You will not have bronchitis. You will not have nephritis, kidney disease. You will never have arthritis or any chronic bone diseases. So it licks the throat. Infection licks the throat, bites the heart. That is what the medical book says. So if you take care of the throat, everything possible. Other things you can diagnose by opening the throat and leaving the torch. If there is a black mark on the teeth, it is caries tooth. It has to be addressed by the dental person. If there is bleeding of the gums, gums are red, swollen, gingivitis. Tongue is swollen, red color, glossitis. Then there will be pain below the mandible, and there is redness in the throat. It is parotitis, salivary gland, tonsillitis, adenitis. If the pus or water is coming through the ear, don't address the ear. It should have come from the throat. The throat and ear is connected by one tube called eustachian tube. Infection has gone from throat to ear. So if you treat the throat, the pus, blood or water coming through the ear will be addressed. Otherwise, when the discharge comes from the ear, means the tympanic membrane must have some perforation. So infection has gone from throat to the middle ear. From middle ear, it has come to external ear. So what is the problem? When you do not know this, you always treat the ear with water wash and put a cotton into it. Disease is there. So disease has come from tongue, might be come from gums, tooth, then salivary glands, tonsils, adenitis, or it is pharyngitis. All these things can, and remember, treatment part will be very simple. Whenever there is a throat infection, pharyngitis, tonsillitis, adenitis, sinusitis, glossitis, gingivitis, caries tooth, whatever it is always infected by single organism. That organism is called beta hemolytic streptococci. It is gram-positive organ. Therefore, you have to give gram-positive antibiotic, erythromycin, ampicillin, trimethoprim, penicillin. This has to be taken, but only the precaution for parents is that it has to be given full course. It should not be stopped in between once the symptoms get all right. And the focus of infection should be eradicated once the child is away from the symptoms. Caries tooth can be repaired by the dental person. Gingivitis, it has got its own. Glossitis, it is a deficiency of the vitamins, can be treated. Salivary gland infection or stone, it has to be surgically addressed. So tonsillitis, adenitis, pharmacological approach first. If it is not, surgically it can be removed, and there is answer for every ailment under the sun, provided you make a early diagnosis before it goes into the other organs. Whenever child complains of throat pain, don't blame him because he has taken chocolates, he has taken ice cream, or he has taken cool drinks. You can address it later. But first, address the problem and give the course of antibiotics under the supervision of the ENT doctor, and your responsibility is to complete the course and symptomatic treatment given. And most important thing you have to teach the child is brushing the teeth after dinner. This is very important. If he brushes the teeth, especially last two upper and lower teeth, where usually the carbohydrate settles down, and carbohydrate, this bacteria wants to take the carbohydrate, also drills the most hardest content of the teeth is enamel, and he has got problem. So every day child has to be given brush, toothpaste or powder. Ask him to brush it properly. After brushing, he has to clean the tongue. All the debris is sitting on the tongue, especially posterior 1/3, where there is a ring of lymphoid tissue is there. And to eliminate that, it is a tongue cleaning is very important. After tongue cleaning, if your child has to be 100% healthy, put little salt in warm water. Ask him to gargle 4 times with clear sound. That not only clears the throat but also clears the larynx. Spit it out 3 times, and afterwards, after gargling, swallow whatever organism has gone into the esophagus, that will be cleared off. So this is a precaution taken during COVID season, and COVID is a mildest virus. It cannot withstand warm water, right, or the pepper water and soup, and then the rasam. It is more than enough. You can completely eradicate the virus from the throat. Whether it is HIV, whether it is a COVID, H1N1, virus will not sustain outside the cell and will not sustain warmth outside the cell. It dies in 3 seconds. The warm water gargling, one child is taught this, tomorrow morning you can give him a chocolate. Nothing wrong. Give him ice cream. Don't take away from the pleasures. But after this, that night, oral hygiene is very important. After taking chocolate, you will be obliged to do brushing. And if you want to test, you ask him to blow the air from the mouth to the palm, and you should not get any bad odor. That means his oral hygiene is good. It is salt, water, common sense. No doctor, no drugs. So you have to strengthen the community in health, school health, examination itself. There, if you teach the child what is the food he has to take, how to keep the nails in trim, how to wash hands before taking the food, how to wash hand as frequently as possible. How many times he has to rub the palms, fingers, tips, and thumb, and how to, after rinsing that, how to rinse the water. It should go from above downwards, not from below upwards. Again, it will go and collect at the fingertips. So these are all the things which is making the community stronger. We have to make the community stronger. We should not ask community to come to the hospital. We go to the community, we go to the school health, we teach the child, and we call the parent, tell them this is the problem with the child, and doctor has given this. You take this thing to the particular doctor, whether it is a dental, whether it is ENT, right? Whether it is eye, everything comes in package. So once reference is there, he knows where to go when there is a problem. And apart from this, a important thing we have to understand in school health is sometimes children is born out of congenital defect from the birth, but it will not be surfaced so soon. Again, it is same thing. Child is growing, right? Height is good, but weight is reduced, and he has got every month or every fortnight this cough and cold. This is upper respiratory tract infection and loss of weight. Think about congenital heart disease. Just you have to take him to the doctor, or doctor has come to the school health. He will just put his steth on the heart and say he has got particular disease. Thus can be corrected in couple of minutes before 14 years. There will be gap between right heart and left heart, and sometimes very severe from right heart to the left heart. Child will become blue color when it cries. This can be identified. All the heart problems can be identified by 2 or 3 symptoms and 1 sign by a school health medical officer, and it has to be followed up properly. Say, what is the problem? Doctor comes, he writes in the register and goes away. Yeah, the teacher and headmaster must have a parent meeting with the child, and when doctor comes, they can ask many questions. Doctor will explain them. This becomes the responsibility of the school when to conduct school health examination, how many people he has to take, when parents are be informed, and what is the responsibility of the doctor, what is to be informed, where the case has to be referred, and how long the treatment has to be continued. When patient is losing weight, right, and upper respiratory tract, sneezing, sore throat, cough. So respiratory tract infection and child is losing the weight, it may be congenital heart disease, because good portion of the blood from left heart going to the right, thereby there will be mental retardation. He is attending the school properly, he is concentrating, but he is not picking up. There is some problem with his brain. Mental retardation, physical retardation, upper respiratory tract infection. What else you want? Child will be having some congenital heart disease, and that will be dug out at school health itself. So very simple things. Everything is in place. Problem is we are not enlightening the public. We are not enlightening the doctor who is going to the school health, and we are not teaching the teacher how to identify these things. Teacher has to be taught in school health. First, teacher has to be. He has to spot out. Sir, nalla padikkiran sir. Examination le nalla eludre sir. Eludale sir. So he has got some psychiatric problem. This is childhood problem. Sir, class le varan sir. கொஞ்ச நேரத்தும் அப்படியே தூங்கிடுறான் சார். He may be having thyroid problem, hypothyroidism, cretinism, very common. சார் நல்லா எழுதுறான் சார், ஆனா பேச மாட்டேன்றான் சார். Simple thing, his tongue is tied. It is not diagnosed by anybody. He is happy, he talks little, that is enough. But question is asked, he will not answer, because he knows he has got disability of moving the tongue. Just put on the tongue, see the tongue tie has come further than the lower one third of the tongue, Just cut the tongue tie, put 3 minutes pressure, and you cannot stop him talking. He will keep on talking after some time. So diagnosis is important. That can be done at school health. When child parent or teacher says, "Pese matandran sir, he is not talking sir, he is writing well sir, he is getting good marks sir." But whenever I ask, he is always hesitating sir, he is not talking to his friends also sir. It is a tongue tie. பட் ரொம்ப தூங்குறான் சார், எப்போ பார்த்தாலும் கிளாஸ்க்கு வந்து ஃபேன் போட்ட உடனே தூங்கிடுறான் சார், டெஸ்ட் இஸ் thyroid. You will have hypothyroid is not functioning properly. He is not an idiot student. He is idiot because thyroxine is not there. He is not idiot because his tongue is not moving properly. So in school health, we can diagnose hundreds of diseases, and all the hundreds can be treated war footing and in small duration, provided they refer to proper centers from the school itself. And more important in school health is that if you examine their fingers and their palm, they will be having some skin problem, scabies. One child has got scabies and hundreds will get scabies immediately. So for that, there is a particular medicine. It has to be applied overnight, and next day it has to be thoroughly cleaned for 2 to 3 baths. It is scabies is gone, and doctor diagnose, and he has to go to dermatology. Dermatology is skin disease, where skin ailments can be diagnosed, and treatment is very cheap, and it can prevent term. So responsibility of the parent at school is that the cloth he has used during the treatment should be washed thoroughly with antiseptic and in hot water, because that parasite will also be there in the cloths. So the mental physical retardation, and moreover what is more important is psychiatric problems here. Child will have depression, or child will have some abnormal psychiatric problem. Thereby the teacher responsibility, community responsibility, school health doctor responsibility, you have to dig out the cause for it. Childhood trauma is very, very important, and parents before having a child, they should know what is child, how development takes place, what are all the milestones, where interruption has to be taken place. These are very important. So common these things, I'll tell you one example so that you will understand. It's a what subject? Childhood psychology is a what subject? Child at particular age is always inquisitive. Inquisitive means he wanted to climb up the stairs. He climbs up. Climbing down needs gravity. He doesn't want to come down. He will start crying. Now the mother who is in the kitchen, when this fellow is already climbed up 5 stairs, she will beat him and drag him down. So his future is very, very important. His future is that he knows how to experiment, and for experimenting he was punished. So he reads well, studies well, but in examination he will not give his potential on the answer book. Then the question comes to the teacher, நல்லா படிக்கிறான், நல்லா பேசுறான், ஏன் எக்ஸாம்ல மட்டும் எழுத மாட்டேன்றான்? இந்த क्वेश्चन எல்லாம் முதல்ல எழுதி இருக்கீங்க. For giving trial he was punished. So parents should know. It is a community medicine. Once again, parents should know how to bring up, how to help children certain time. So another example, at the age of 3, they are always very inquisitive. Father comes from the office, he removes his watch, keeps it on the table, goes to the bathroom. This fellow who was watching, he goes and takes the watch, and he is so thrilled by listening to the sound, and the needle is moving. Father comes out of the bathroom. As soon as he sees the child, he will shout, "Hey, கீழே போடாதடா, ஒடிஞ்சிடும், போடாதே, போடாதே." Then the fellow said, "I am just keeping. Why this big fellow is shouting?" He drops it. He wanted to see the reaction of the elderly one. Now what is the problem? It breaks, and he will be beaten up. So now you know how to grasp, observe, and enjoy, but having experimented, he was beaten. These are all the people, executives, who become executives when they heard that they are going to be deputy for another fellow, they will commit suicides. So behind every suicide, there will be child trauma. The child is always longing to sit between father and mother. Remember this very important aspect of childhood development. Always want to sit between. If you think it is a hindrance, if you think it is a nuisance, you remove the child. That fellow will have little abnormality because he always wants the features of the mother. She always wants future of the. This always bisexual. Child is always bisexual. If you do not address it properly, if you do not tell them the reasons behind what you are doing, they will not have reasons, and they will have all sexual imbalance after the marriage. For every psychological imbalance, there is a childhood trauma we should not forget. We don't have time to ask for the childhood development. We don't know. The child who is born, right, out of cesarean, he's got little problem. He is delivered by forceps, he will have little problem. He is delivered by prolonged labor, hard labor, assisted labor, cesarean, which is not natural, will always have a problem. And once you identify this is a risk group of child, in school health itself, you tell the teacher this is his problem, and he identifies. You have to do only blood test. It is a thyroxine which is not there. So thyroxine, he becomes active in 10 days. Treatment is cheaper. Treatment is easy. So we don't know the normals. If you don't know the normals, you will not know the abnormals. So parents should know the child, teacher should know the child, and doctor who goes to the school should know the knowing, not physical examination. It is psychological, social, right, nutritional, and disease at the home. All these things should be very important. Now, again, in HIV, if you find out any HIV child in the school, it is very, very important responsibility of the community and school authorities. If by chance, by blood test, child is diagnosed HIV, right? If you write in the record is HIV positive, you will be put behind the bars. It is very secretive one. You are not supposed to reveal to anybody except to his or her parents, and only on the consent. And HIV child should not be segregated from school. He has to study in the same school. He has to eat food with them. It is not spread by sitting with, using the toilet, and using the books, using the chalk piece, using the pen. It spreads through blood. It spreads through many other routes, not by touching, not by food, not by use. So if you do not know these laws, rules of some diseases, and confidentiality is very important in that there is no special schools for them. They have to study in the same school, and you cannot segregate them. If the HIV patient comes to the hospital for operation, for example, which is a specialized area, may not be concerned to you. If he comes, he is getting admitted, and we know that he is HIV, patient surgery should not be postponed. Patient treatment should not be postponed. Patient list in the operation should not be lowered. HIV, adnale karsile pandla, no way. It has to be done same order. If you postpone, doctor will be put behind the bars, because you are using the instrument, same instrument, you are not going to use it for the next patient. After using the same instrument, you are going to sterilize it. That is the problem of infection. And all the universal precaution, doctors and theater people are already taking. They are wearing the gloves, wearing the goggles, wearing the caps. So universal precaution is more than enough here. Until they get injured by themselves. So when A doctor or nurse can get infected by HIV only when they injure during surgery if the blood crosses over. Otherwise, infection is universally, precaution is more than enough. These are all special, you people, universities, and should know. HIV is going to be with us for some more time. Precautions you have to take, and especially when you want to dispose of the body of the HIV, and it should not be taken for granted, and nobody knows for sure how long the virus will live in the dead body. So in dead body, whether virus will be still alive, if I handle the body, the virus will transmit it to me. Nobody knows for sure. Then the universal precaution, it has to be put into the polythene bag, tie it up, and take a bigger one, put lime, bleaching powder in between, and you have to tie it and close all the nostril, oral cavity, anus, and secretion will not come out. Where is the problem? Because we do not know the remedies, we always take extra precautions and put people into trouble. When they want to dispose of the body, they say, no, your HIV, you cannot be buried here. Your HIV, you cannot be burnt here. It is all legal problem. They have got same rights as you and I. Only thing you have to take little more precaution. Sir? Yes? Yes, sir. Yes, sir. Sir? So you are going to face in the future is how to dispose of the body, how to handle HIV people in the school, outside, in the hospital, right? And precaution. If the, say for example, if the HIV patient blood is taken to lab, in between lab and ward, the bottle has fell down and is broken. So what is the precaution you have to take? Same precaution. You put bleaching powder on that for 7 to 10 minutes, then take it away with clean wash. It is more than enough. Only thing, when it falls down, don't touch the blade with bare hands. That is more important. It is for you to give caution to the people working under you in the lab. Lab, it is all hazards happen. So immediately water attendant wanted to clean it up, uses his own hand, and he has got any abrasions, it is more than enough. He get admitted. More than HIV, the most prevalent one is hepatitis B, which is transmitted through the blood very fast. And once hepatitis B, it is very difficult to treat, and lot of precautions has to be taken. Again, I'm telling you, it's all small things we have to take care of apart from treating. It is not treating which is important. Preventing many diseases. All diseases can be prevented. Primordial from the birth itself, before birth itself. It is called antenatal. Yesterday also I was talking about. Again, I am going to talk. Antenatal, when by the day she become pregnant, you have to take the action. Action is we have to educate. What is the food he has to take? What is the immunization he has to take? What is the exercise she has to take? What is the weight she has to maintain? In case of red signal, what is the things she has to come and report? So first trimester 3 months, second trimester 6 months, third trimester, all different things. So catch them young. Diseases can be completely controlled, and if possible it can be eradicated provided we take the prevention aspect. This is primordial prevention is before birth itself. If parents are healthy, so child will not be ill health. Low birth weight comes because mother herself is low birth weight. It is because of anemia. Anemia is because of menstrual problem before pregnancy. It is the malnutrition. She has not taken proper diet, and it is worms and letting out the blood through the sneezings, in cough, in vomiting, in urine, in passing the stools, piles, fissure, and these stones. So you are letting out the blood throughout your life, and you become pregnant. Naturally, your hemoglobin will be less. You should have treated the cause. Now you have become pregnant. So how to raise your hemoglobin? In the 5 trimester, they give particular drugs to treat it according to the state of the anemia. So this prevention for which we are all struggling today, why we are educating yourself, why I get educated, going to seminars, is to prevent things. Curing is very difficult, very cost oriented. We cannot do that. Prevention is only education. Prevention is tool, IEC, information, education, communication. So what to talk to whom? So what we have to teach to the teacher, what we have to teach to the parents, what we have to teach to the child, and what is the first meeting? In first meeting, what is that we have to disseminate? And when you take a specialized training, how to train the teachers to identify. So teachers are there with them 8 hours a day, and parents 16 hours, and educate them first. Then you educate your own team. You, before sending him as a medical officer to the school health, you must know what is the circumference of the head, what is the circumference of the chest, what is the circumference of the abdomen, what is should be the height, what should be the weight, what is malnutrition, what is marasmus, what is kwashiorkor. So unless a doctor knows what is school health, what are all things I am anticipating, you will become a medical doctor, and you will just examine, putting the steth 3 times on the chest, and there is no parent there to complain. NAD, no abnormality detected. How you abnormality of the worms you can detect unless you ask for information from the patient or from the parent, from the teacher. Before that, medical officer should have gone there to teach teacher how to identify this group of people. So what are all the symptoms of particular disease? So it is health education which is mainstay in our country, developing country, to prevent many serious diseases, especially, say, if you teach community the nutrition part, there will not be any problem regarding diabetes, hypertension, heart problem, cancers, ulcer, and stroke. It is only food, it is only salt, it is only sugar, it is only particular oil you have taken the root, not taken by everybody. Therefore your cholesterol is high, therefore your sugar is high. Then all these things put together, before ending this session, it is a stress which is very, very important. Today it is only because of stress. We are unnecessarily thinking about unborn tomorrows, thinking about dead yesterdays, forgetting about today, and we are not taking care of today. It becomes a burden of tomorrow, and you are unnecessarily taken burden of yesterday and today, and most of your time is gone. It is stress, it is unnecessary worry, right? And anxiety. Most important thing, anxiety. So today we have got an examination. Today is a physics paper. So you have to prepare for physics. You have to think about physics. Suppose you think instead of physics, if they give chemistry paper, what can you do? If I go, if there is no ink in the pen, because there are all the things you are not prepared for. If that anxiety comes, anxiety leads on to the unnecessary hormones in the body, especially cortisols, which takes away your health in few hours to few days, and it becomes a chronic stress. Chronic anxiety is the cause for diabetes, hypertension, heart attack, stroke, and cancers. All the basics once again. all the basics are very important, and your healthcare sector, should know the basics, not the diseases. When the disease is diagnosed, it will go to the professionals. But our part in the community, at our level, whether you are a lab technician, nurse, physiotherapist, you have got major role to play to prevent diseases and prevent complications and prevent recurrence. If your knowledge is not good, you are always a curative person. When patient comes with some ailment, you treat the symptoms, and symptom is the disease complaint. You are taking complaints into war footing, and disease is there. It is just like clearing the water before clearing the drainage, before clearing the obstacles. If you clear the obstacle, disease is gone. If you take care of the mosquito, malaria is gone. If you take care of worms, your anemia is gone. Your mental retardation, physical retardation, and respiratory problems has gone. Take care of the primary disease, and it is called pathology. To know pathology, you must know physiology. Physiology, for example, yesterday I was telling, it is not 120 by 80 is BP, it is 90 to 140 above and 90 to 60 to 90 below. Anywhere is normal. If it is above, it is called hypertension. Below, it is called hypotension. Between hypotension is more dangerous. It has to be treated properly. In hypertension, there are three types. Only above figure is more. It is systolic hypertension. Below figure is diastolic hypertension. Treatment differs. Only systolic hypertension, only stress management. Right? Once you sleep well, right, and you address the problems properly, hypertension is gone. No doctor, no drug is disease. This disease is gone. Diastolic, you have to reduce your weight, you have to reduce your salt consumption, and lifestyle has to be little changed. In case of both systolic and hypertension, you need body weight to be reduced, regular exercise, and the salt consumption plus drugs has to be taken. So there is no big deal about it. You have to know, because hypertension is so common, diabetes is so common now, and cancers after certain years is only very common. And there is 1 minute left. Cancers always comes from what is left behind. Means in every day you have to pass 750 grams of stool. You don't have time, you sit on the toilet bed and just train, and that the 100 grams come, you are satisfied. What is happening to the remaining stool? The another stool will come and join. The residual stool will irritate the rectum. You have got a rectal cancer. Person has got cough and sputum is there, but you are not taking the treatment, sputum is not coming, and cigarette smoking has killed the cilia, there is expectoration is coming, whatever mucus staying in the lungs, lung cancer. And prostate cancer is coming, the prostate secretion is not clear, and secretion leads to prostatic cancer. Stomach, when you eat, before it is completely digested, reminiscence are there, it is irritating the stomach, cancer, stomach has come. So you are smoking continuously, there is a protective apparatus called cilia, that air is demolished by the smoking, so the sputum is not coming, and mucus has got glucose, bacteria grows, chronic infection leads to cancers. Urine is not cleared properly. The minimum 220 ml you have to pass per day. You have to pass 1000 ml. When you remain, because of lack of privacy and there is lack of time, you are retaining the urine for a longer time. The retention is cancer. It irritates the bladder, and long term it produces bladder cancer. Thank you. Let us have 5 minutes break. We will reassemble. Thank you. Welcome once again. So we have been very detailing about certain things which is not covered up with our topics also. Next topic is on anesthesia, which is very important for all procedures, including catheterization, surgeries, and all these things. Only basics you have to know. Anesthesia is to numb the particular part or the body from the pain. So it is mandatory for all the surgeries, and this anesthesia is usually divided into so many types. One is local anesthesia, where we do a surgery on particular part, small part, where we do not want to give general anesthesia and get rid of the problem, like an abscess, or to remove the wart, or to numb the limb by scorpion sting. Local anesthesia means we are going to give a local liquid by injection form into the nerves on either side of the finger, so that the distal part becomes numb and we can operate on that. The another one is, as you know, it is called general anesthesia, where we are doing major surgeries in the abdomen, thorax, or in the any part of the body where surgery will take longer time. A patient cannot be kept under local anesthesia. It should be given general anesthesia, so that the oxygen consumption through the endotracheal tube will be continued, and nutrition will be given by IV, and the major operation is done. All surgeries usually in all government hospital is given by general anesthesia. Another one is there, it is called the spinal anesthesia, and this spinal anesthesia is to do usual the surgeries below the umbilicus, like piles, fissures, fistula, and correction of the congenital abnormalities of the limbs, or the amputation, and even the obstetrics problems, where they have to do something about the uterus, ovary, fallopian tube, the spinal, and this spinal is that it is only little time bound. After that, it won't work. Thereby, if there is a major surgeries to be done below the umbilicus, we give the epidural. So this epidural is very important, and this epidural is for prolonged spinal anesthesia, and it will also maintain the blood pressure, and there will not be any problem with the respiration, and that is most safer things. And this will be given usually by the anesthetist, who is a specialist in anesthesiology, and this is a postgraduate subject studied after MBBS, and this will be 3 years course, and there is super specialty in that also. And that super specialty, one thing is anesthesia. Before giving anesthesia, the people should understand they are the people who decide whether surgery can be done or not, whether the patient is fit enough for surgery, or you have to postpone the surgery, or you have to do surgery in case of risk. So they will alter the anesthesia, and they will control many other parameters, but they cannot say no in emergency. But in elective cases, they always make the patient fit: blood pressure, respiration, temperature, pulse, then urine output, everything they see, and their hemoglobin and blood test, various blood tests, whether kidney is normal, lung is normal, liver is normal. They have to do all the tests, and with the test, it is called pre-anesthetic checkup. Only pre-anesthetic checkup, the patient is fit enough, then only they give anesthesia. Otherwise, they postpone or they change the mode of anesthesia, and all surgeries. Only this person is very key person, and he is the one who sees whether case sheet is correct and consent is taken. This consent is very important, because that will land up people in lot of problems. Consent is an agreement between patient and a doctor, and the doctor should have explained the patient what is the ailment, what is the disease he is suffering from, what is the mode of surgery is going to do? Is there any alternative methodology by which the ailment can be addressed? What is the type of anesthesia is going to give, and what may be the complication after surgery as to explain. This is called informed consent. So first the doctor will explain the disease and methodology from which it can be cured, and mode of anesthesia, duration of surgery, some complication during surgery and after surgery he has to be explained. And after all these things, again he has to sit with the family and explain all these things what he has explained to the patient. Then they have to get signatures from the patient, family member, and doctor has to sign, and this is called informed consent. Without that, no surgery should be carried out. This is again, you have to be aware, this informed consent. So the problem is that many people, they take only signature of the patient. Signature has no value in law. Signature should be followed by name written by him in capital letters, and this name should be prefixed by initial, and should be prefixed by status of a woman, Miss or May, Mrs. Again, all smaller things what you think will land up in problem, and law has no consideration for a professional person. Signature should be followed by name should be prefixed by initial and prefixed by status of the person, and all the signatures, all the name should always be followed by date, month, year. Do not forget this. Wherever you give application, date, month, year should be there. Year, the date, month should be written in particular place. When there is double digit, it has to be put 04, 06. You should not leave the blank there, write only 6. 1 can be added, 2 can be added for the date, year, same, 1 up to 12 months they can add. All smaller things, but plays a major role in medical legal aspect and in the forensic and also in the law. In the court, first thing they see all these things. If this only signature is there, name is not there, date, month, year, it is negligence. Case is different. And second person, and most important, after putting the date, month, year, you have to put the time of your signature. It is 10 a.m. Then you are taking signature from the relative. Who is this relative? It is the first family, wife or husband. If they are not available, mother, father, elder brother, elder sister, younger sister, only that family has to sign. If they are not there, we have to write in case bold letter that parents not available, spouse not available. Who is this person? Who is mother-in-law of the patient. Mother of the patient has to be written. Otherwise, it's penalized. It is followed by date, month, year. His signature, his name, his status. Again, date, month, year. And he has to put the time. Then third person is the witness, maybe doctor, maybe nurse, maybe other person. Again, signature, name, same status, date, month, year, time. These 3 times, it is 9 a.m., 9 a.m., 9 a.m. It is negligence. So there should be gap between 2 signatures. After explaining them, the doctor has explained to them, it would have taken 15 minutes. So it is 9 o'clock, it is 9:15, and it must be 9:30 and above. If the time is not mentioned, fine. The signature is not there, fine. Name is not there, fine. Name is not followed by initial, fine. Name is no status, fine. No date, no month, no year, fine. Date and month, no year, fine. So everything now it's settled down in the consumer's court, and for everything, even to take a blood, you have to take a consent. To give injection, you have to take anything you are introducing to the body. It is dangerous. Pain itself may kill. vagal shock. So many people do not know all these things. When you want to take a consent, it has to follow in same. There should be time gap between three signatures, maybe minimum 10 to 15 minutes. If it is a big informed consent, mode of there is a robotic surgery, then there is a laser surgery, clearly mentioned. Whether this person is qualified in that, you have to mention. So you cannot have a person who has not trained in robotic surgery cannot operate on the patient first time without having experience. That will be counted in the legal aspect. So after the consent, after telling them this is the disease, this is the mode of treatment and consequences, and second important things, many doctors do not know, when consent is taken for a surgery or any procedures, you are giving in between blood. Separate consent has to be taken for blood transfusion. Mark this, it is very important. Surgery is done, you have to give blood, but most of the time, the consent will not be taken for blood transfusion, thinking that it is a part of it. It is not a part of it. Blood complications are different from complication arising out of surgery. Blood itself can kill. Mismatched blood transfusion can kill the people. Complication arising out of blood transfusion, complication arising out of surgery is entirely different. And therefore, even before giving the blood transfusion, we have to obtain blood transfusion, and you have to mention his blood group you have collected, and you have to make sure that this is the same blood we are giving to this person, and after explaining them before surgery. Thinking that again, smaller things are very important things. Anesthesia department will take care of all these things, and that department is very vital for all department of surgeries. It goes hand in hand. Always it is for the protection of the patient, and they usually consult each other, anesthetist and all. They plan the surgery and duration of the surgery. If surgery is prolonged more than that, keeping the patient under general anesthesia itself is dangerous. Anesthesia itself is dangerous if it is prolonged. So they have to tailor make the surgery for the anesthesia. Anesthesia should be maintained, and it should be fixed everything. If the time is going ahead, anesthesia will always caution the surgeon to fasten the surgery, and the change of mode of surgery is also taken. These are the intricacies we have to understand with this, because now lot of cases are filed against the hospital, doctors, and the health team, and we are answerable to that. Once you make a mistake, then there is no way in court we can all to end up these smaller things. Supreme Court is very clear. Whatever you do, right, do it properly, do it correctly, let your procedure fits into the patient. More important, you have to remember what is not written, not done. Everything after operation, you have to write operation notes. Anesthetist should have written the complete note. Nurse should have written her notes. If notes is not proper, you have not done the procedure properly. In the court, first hearing itself, they will fine you crores together in case of death. It is called medical documentation. Consent must be there, surgery notes must be there, and anesthetist notes must be there, prognosis for nurse must be there. Everything should be updated from the time you have taken up for surgery, time of finishing the surgery, time of recovery, and post-operative period. Everything should be documented. If no document is there, if document is insufficient and patient dies or morbidity, some defect is there, you have to pay the penalty in the court. So Supreme Court is very simple for medical people. What is not written, done. You have done everything, but forgotten to return, lazy to return, do not know what to write. So more than your clinical knowledge, surgical skills, these maintaining the records are very important today. That's why that big department has come. It is called MRD, Medical Record Depot. It is bigger than anything today. You have to maintain for children almost 23 years. Records should be there. If something done on a child, it should be recorded because recurrence will be there. For other things, speculation of time is there. Medical legal for so many years. For general records, so many years. After that, that can be demolished or it has to go into print media. So these doctors may not know all these things. They are very good in surgeries, very good in doing their procedures and all these things, but medical legal aspect, forensic aspect, and medical sciences, I mean forensic science is very important. So is the forensic nursing today. It is gearing up. Now doctor is not owning the responsibility. If an instrument is left in the abdomen, a gauze is left, pad is left, after operation, some complication arises. Earlier only doctor is to be punished. Now there are doctorate in nursing. They are responsible. How many gauze pieces you have given? How many gauze pieces you have recorded? What is the weight of the gauze piece B minus A? So blood loss. How many instruments? It should be completely documented, and you have to tell the surgeon before closing the abdomen that we have equipped everything. If she has not given that statement, he has closed. Now they have to share the responsibility and also fine, and in case of punishment, it should be responsibility of the team now. That is surgeon, nurse, and theater attendant. They have to keep the checklist. There is called protocol and checklist in all the hospitals. So these are all the tests you have to do for this surgery. These are all the instruments you have to take. Only this instrument you have to take. This instrument you given. How many? Number. And number as re-equipped. Blood loss as gauged by wet gauze minus dry gauze. So she has to give so much of blood is lost. Anesthetist will manage to give IV fluids or blood. You think it is all very intricate, but it is all very important. Other things are already there in the books, already there in internet. You need not have to attend these classes. But it is better to know many things other than what is already written. It is in between two lines. That is very important. And last but not least is the lab, which is the heart of medicine. And there are so many intricacies in that. Most important preliminary lab investigation is blood. Blood, it is hematology, it is biochemistry, it is again immunology, and again the most important other than hematology is pathology and microbiology and biochemistry. Hematology, to see a simple example, is that it is hemato means it is a blood test. Taking blood, we have to say infection. If there is infection, so there is army must be 6,000 to 10,000. If WBCs are 6 to 12,000, it is normal. If you see WBC is 15,000, immediately know army is more. There must be some injury, there must be some inflammation, there must be infection. So easy in one drop of blood. So immediately, what sort of infection? Should I go into war footing or can I wait? Yes, it is called acute disease. In all acute diseases, in all pyogenic diseases, in all bacterial diseases, it's all which needs IV antibiotics, which needs doctor attention. It is only polymorphs will increase. Polymorphs should be like 60 to 70%. If that is 90%, that means it is acute infection, pus-forming infection, bacterial infection, life-threatening infection, needs IV antibiotics, needs patient to be called. So simple. And if polymorphs are not more, lymphocytes are more, it is a chronic disease, it is a late disease, latent disease. Usually in India, it is tuberculosis. So easy. If eosinophils are more, it is allergic phenomena, maybe worms in the body, it is filaria, it is asthma. Then again in asthma, you take eosinophilia in the blood and eosinophilia in the sputum, If the eosinophilia in the sputum is higher, it is 1000% bronchial asthma. Take a tissue in the respiratory system, eosinophilia in the tissue, blood, and the sputum, 1 million %, it is bronchial asthma. It is, for basics, it's more than enough. With 10 rupees, you made a diagnosis. Then, coming to other part of this, in hematology, we find out blood groups, and you know, AB and O, it is a common blood group, RH positive and RH negative. Only thing you have to make sure same blood group should be given to prevent complication. If the wrong blood group transfusion is given and all RBCs will rupture, they may die of the acute renal failure or maybe because of shock. So this will be taken care of the nurses at every stage, before giving, before sending it, cross matching. They will be doing all those things, and this hematology is a very important thing to say whether there is infection, inflammation, or there is injury. All these things, the army will change. Uniform of the army will change. One drop of blood. In biochemistry, we wanted to make sure the liver is functioning properly. It is called LFT, liver function test. Before surgery, before any disease, to give antibiotics, LFT is important, liver function test. All the drugs given through any via any media, it will go to the liver, and poison part of the drug is taken away, then it will send to the portal circulation. The other time, the liver should be healthy to give drugs. So LFT means we are seeing serum bilirubin, serum proteins, total and differential, then SGOT, SGPT, then prothrombin time, some small these things before sending them for surgery or to give any drugs in disease. Then all these drugs will be eliminated to the kidney. We have to do renal function test. So whether blood urea is normal, then uric acid, then creatinine, then serum electrolyte. There are so many. So once urea is more, creatinine is more, kidney is in disease condition. Don't give antibiotics. Give it in different way. So it gives you clear idea whether you have to be treated in different way, what is the disease. Then you have to have X-ray chest. In X-ray chest, we know when any disease is there, pneumonia, bronchitis. So in X-ray itself, we can make out. Then we have to take ECG to show whether heart is healthy or not. Simple things. If there is some defect, we can do echo, then we can do angio, and we can do CT scan, we can do MRI. So many others are there. Preliminaries are very important, where we can rule out many things. And most important thing in lab science is microbiology. Microbiology means it is to pinpoint the diagnosis. In case, for example, urinary tract infection. So clinically we know he has got frequency of urine and painful urine, urgency of urine, foul smelling urine, and he has got pain underneath the umbilicus, and he has got fever, he has got urinary tract. This is clinical. This has no value in the court. Evidence based means laboratory. Means there is a urinary tract infection, means you have to do minimum test is urine for sugar and albumin. Urine, there are three things for 5 rupees. Urine for sugar. If sugar is plus, that means he has got diabetes. If albumin is plus, he has got kidney problem. If RBC is present, that means blood is there, he has got stones. Blood above 40 years, maybe tuberculosis. Blood in the urine after 60 years, it is malignancy. In 515 rupees, you have got already 9 diseases. Then he has got pus cells, he has got bacteria in the urine, that means he has got urinary tract infection. It is not sufficient in lab. What is urinary tract infection? What organism has caused urinary infection? Then we have to do urine culture and sensitivity. A bigger thing, it will take 24 hours to 48 hours, where we culture the organism and we know which antibiotics is suitable for that organism. Before that, we have to take precaution. That is why this class is important. Is collection of urine. It is midstream urine, that he has to pass urine for some time. Then in the middle, he has to catch the urine and put the cork. And urine should be only half of the bottle, not full. It should not touch the cork. And it should be immediately sent to the lab. And this urine, they put it into culture media and see so many bacteria. Only in particular cube, the bacteria has grown. That means only that organism. It may be E. coli, it may be Pseudomonas, it may be Klebsiella, it may be Streptococcus, whatever it is, a documented proof. Now, sensitivity will tell you what is the antibiotics to be used. Particular antibiotics, you need not have to worry about it, because by intuition you cannot use antibiotics. Antibiotics are dangerous. So according to sensitivity, we are giving antibiotics for so many days. Again, we recheck the urine. By that time, pus cells should not be there and there should not be any organism. That means your treatment is correct, your recognition of the organism is correct, and diagnosis is correct. Otherwise, we have to prolong the treatment for some more time till urine becomes sterile. That's where it stops. So, in case of women where both the openings are the common opening, there may be some infection. It is called auto-infection. Urinary tract infection is very common in women because of short urethra and menstrual disturbances. Because in menstrual blood, infection will be there, and it is called auto-infection, or the fecal matter may enter into the vulva and it may infect the vulva, vagina, or urethra. All these things have to be taken into consideration. Microbiology will give you the final diagnosis and treatment will be carried out. If they are married, both the partners has to be treated. There are two cases where there is a white discharge. Woman is married, she has to get treatment and he has to treat the husband. And sometimes 3 cycles. These are all small things, very important things we are missing in treatment also. We give treatment, we forget about it. They may not come back. Once there is another white discharge, they think it is failure of the treatment, they will not come back. But we should have told them how to continue this treatment, how long, what is the criteria to stop the treatment. Those things are very important things where a community will also participate in. Most of the things women suffer other than this is these things. Another one is pathology. This pathology lab is most important lab in medical, because pathologists are the only people who give the final diagnosis. It is the tissue change. This is very important, not clinical disease. What is change? Whether it is benign tumor, cancer, or any disease process is taken place, what is the stage of the disease, what is the treatment required, it is the pathologist who always gives the final diagnosis. Only with pathologist the opinion and pharmacology treatment is given. Without pathological biopsy, we cannot proceed to diagnose any case anywhere. All the diseases, we have to take the tissue, submit it under examination of the pathologist, and prove that the tissue is degenerated. For example, simple examination, RBCs, when they are matured, they should not carry any nucleus. When they carry nucleus, it is premature RBC, maybe cancer. So pathologist will give us clue, say that it is not normal cell, it is premature cell. In WBC, granules should be there. If granulocytes do not have granules, there is some problem. Granulocytes, if granulocytes are there, it is. So first you must know the normal physiology. Then you know the abnormal pathology. Then convert pathology back to physiology is by pharmacology, any method. whether it's a physiotherapy, Ayurveda, Siddha, operation, right? Or by drugs, whatever means, converting abnormal back to normal is pharmacology. Pathology is abnormal. It may be above, it may be below. Physiology is lower and upper border. Within lower and upper border, health is intact. It is physiological, healthy, nothing to worry about. But once it crosses the border, we have to put it back, and there the lab will come into picture. Especially meningitis, very severe. In matter of hours to days, child will die. You put a needle in subarachnoid space, get the CSF, examine. If the cytology cells are more, it is infection. If only polymorphs are more, it is pyogenic meningitis. If lymphocytes are more, it is tuberculosis or viral. In 5 minutes, we can decide. Biochemistry in CSF, the sugars must be only this much. If it is less, it is infection. Chloride must be this. If it is less, it is because of vomitings. It is the protein has gone up, infection is in subarachnoid space. Everything is simple, provided we know the basics. Otherwise, every time we have to open up the book, every time we have to go to internet and ask for information. Whatever information you already having, it has to be substantiated by evidence. That is more important than anything else. But as I told you earlier, what determines is again basics. In community, this is the disease. In obstetrics and gynecology, just to refresh our memory, is that the commonest gynecological problem is white discharge. White discharge is because lot of cells are dying in the uterus, and it is natural. It is like a dandruff. The woman should understand, community should understand. White discharge is not a disease. When we have to give attention to this, if the white discharge is too much and she has to change the linen very often, it is pathological. And moreover, if the white discharge after some time changes into other color, say yellow color, it is pathological. More important is when this white discharge is supplemented with fever, it is pathological white discharge. Most important, by one symptom you know this, is a white discharge, it is not nagging, now suddenly become foul smelling, it is infected leukorrhea, it has to be treated. So there are antibiotics for that. It has to be taken 7 days to 10 days in every cycle, and it is for 3 cycles. If person is married and usually it is infected by a man, he has to be treated with same antibiotics, and your general health has to be increased by vitamins, minerals, macronutrients and micronutrients. And this to congestion to come down, you have to drink 10 glasses of water. It may be water, it may be buttermilk, it may be juice, it may be ganji, it may be soup. So it has to be repeated. It may be tender coconut. This is what community power is. For everything, you should not go to the doctor. So if you know what is rehydration, what is to be given, this one plain glass of water, 1 glass of ganji, 1 glass of tender coconut, 1 glass of diluted juice, 1 glass of buttermilk, 5 glasses, 6 to 12, 12 to 6, 10 glasses. So it reduces the congestion, urine output will increase, and disease will reduce in reproductive system also. So if tender coconut is very costly, just you have to take a bit of lemon and squeeze it in a warm water, put little sugar and little salt, pinch of salt and 1 spoon of salt. That is more than enough to rehydrate. This is the empowering the community once again. Most nagging for a woman married or spinster is dysmenorrhea, painful menstruation. This is also the cause for absenteeism in the offices and also in the schools among girl children. Very, very common. So once it is there, dysmenorrhea has two aspects. One is congestion. Because of the congestion in the uterus, this happens, and contraction of the uterus leads to, it is contraction. Okay, so it is contraction which leads to painful menstruation. It may be 3 days before the menses, during menses, after 2 days. It may be total 10 days. Some people will have more pain before, more pain after. Some people during menstruation. It is different types, but it is all because of congestion, and it is because of not relaxing the body. So we have to take treatment again 3 cycles by muscle relaxant, and more important, when woman knows that she is going to menstruate and she also thinks that pain might come, triggers the hypothalamus, and you will have spasms. So you have to get anxiolytics which destroys the anxiety, and you should have painkillers for 10 days, and you must have the minerals which got potassium which relaxing, and this should be continued for 3 cycles. And once you hydrate yourself completely, you can eliminate 2 things. One is urinary tract infection, another is dysmenorrhea. Dysmenorrhea is painful menstruation. Next comes is the obstetrics, where pregnancy should be clearly defined earlier, and it has to be planned correctly. You want to postpone pregnancy after the marriage, so there is a family planning methods. And second thing, you want to plan a duration between 2 pregnancies, that is different. There may be tablet, there may be loop, there may be temporary methods, many things are there, condom is there, and it all depends upon you and your partner to decide about it. Once you decide, you have to stick to that, and once you decide to have child, you can forego the temporary method and do it. And after a couple of children, you decided to have a no to the extra child, then permanent methods is, one is vasectomy, another is tubectomy. Both tubes are cut and averted. In case of women, it is called tubectomy, and there will not be any pregnancy. That has to be decided. Now laparoscopy has come and hospitalization has come down. Yeah, the best method is, it is better to advocate this family planning for a man. It is vasectomy, 3 minutes job, and there will not be any complication at all. It is done properly, so that methodology prevent many of the unwanted pregnancies. Now, unwanted pregnancy, they don't want to adopt anything. There is an emergency pill has come. They have to take it in couple of hours after copulation, or can be taken in preventive aspect. It is, these tablets are called emergency pills. It is available in non-pharmacies. They should not ask for the prescription. So these unwanted pregnancies are causing lot of problems to the women before marriage, after marriage, wherever, whatever may be their stage, and they have to use it. Their knowledge is very important. Temporary methods are too many. There is a gel, there is a woman condom, male condom. Condom has to be used in particular time, and disposal of the condom is very important. And what is the education in obstetrics and gynecology, how to use the condom, how to remove it, right? What sort of condom he has to use it, whether it is the rubber condom or synthetic condom, and whether we have to use some spermicidal inside. And in case of spilling, what is the precaution you have to take? So it is a wash, and also take emergency pill. So this education cannot be taught overnight. That is the problem with medical people also. Medical people, they know, but in cases of something accident happens, they don't know where to turn to. General practice is always a problem. where they should know all the medical sciences together. Specialists, they are different. But here, he has to advise his patient if they want to prevent this thing, what is the best way, whether pill. So, how to take a pill. If they miss pill on that night, how to take it immediately next day morning. They should not be panicky. She has missed the pill. They become panicky. They know panicky. They will go for abortion and septic abortion, pus, all sorts of infection. Ultimately, uterus has to be removed. So, unless education is there, information is there, and you don't know how to communicate people because of out of shyness, they are not asking for information. That's why family planning, they spread it on the table, and you have to choose according to color. I have to tell this is birth pill. This contains estrogen and progesterone. This prevents the fertilization, means it prevents the pregnancy. This has to be taken so many days, and this has to be continued during menstruation, and the color tablets are there. Okay, when you got a doubt, use double precaution. Ask him to use the condom, you take the pill. So where do you get all this information? Where to turn to? Where is the time for you, and where is the time for a doctor to tell all those things? All smaller things has lead. So for example, it is what is the catastrophe happens in many cases. Many people under the impression, including the educated people and doctors, when mother is feeding the child, she will never become pregnant. This is the myth going on for a longer time, and even now it is existing. So lactation prevents pregnancy. So what is the importance of education here is that this is uninterrupted breastfeeding. If you continuously feed 4 times a day, conception will not take place. But what is the problem in the community, in the families? Sometimes because the mother is infected, she has got some cough or something like that, they separate the child from the mother. She is free from lactation now. She is free from feeding now. Okay, 4 or 5 days. In between these days, if she has got sex with her husband, she can become pregnant. So we have to tell them after discharging from the hospital, she may not ask this. She wanted to postpone the second pregnancy, right? She wanted to have a second child after 3 years, and it is her decision. But she has expressed, but you are not given the precaution. Because ANM is there, her knowledge is not good enough to tell all these things. That's why I'm telling ANM in Liverpool, if you go and ask, she knows everything about contraceptive. She says, when there is an interruption of the lactation, use condom or female condom, male condom. So prevent unwanted, unnecessary pregnancy, unwanted child. Instead of that, you are also telling that நீ பால் குடிக்கிறவருக்கு எந்த ப்ராப்ளமும் குழந்தைக்கு குழந்தைக்கு பால் குடிக்கிறதுக்கு உனக்கு எந்த ப்ராப்ளம் இருக்குது, பிரெக்னென்ட் ஆக மாட்டேன், சும்மா இருக்கிறவங்க சொல்லி விட்டுடுவாங்க. That is the problem with medical people. This soft knowledge, what happened? They volunteer this information. She thinks to be true, and after 6 months, 9 months, even if you give uninterrupted milk, chances of becoming pregnancy is there. So what is temporary method, when to use this is very important. So apart from that, it is always better to, last but not least, better to avoid, right, cesareans and surgical assisted labor. It is natural birth is the best way. Breast milk is best. There is no substitute here. There may be some absolute indication for cesarean. Let us leave it to the doctors. But to prevent unnatural birth, unnatural pregnancy, we have to prepare the woman for pregnancy. It is exercise which is important for a woman, especially lower body exercise and pelvic exercise. which is very important, which is start in the first trimester itself. If you continue exercise, you can expel the child without any problem, without any assistance. It is the psychosomatic. It is already in the mind. You have seen some film where mother has died during pregnancy and parturition. That is in their mind. So it has to be addressed properly. So it is motor, it is muscle. There is a physiotherapist. They will teach you how to sit for the toilet, how to micturate, how to put a pressure on the uterus during parturition, and also this exercise which strengthen the levator and coccygeus, which is called tail muscle, which is also called pelvic diaphragm. If your pelvic diaphragm is strong, 2 times you exert, child is, however big it is coming out. So don't put on extra weight during pregnancy. According to the trimester, the weight has to go up. Don't feed the mother unnecessarily with lot of food, which increases obesity. Once fat cells are accumulated in the abdomen, she cannot exert pressure. She has to undergo all this torture. Child head will come, body will not come, and we have to use forceps and other things, and it makes tear in her pelvis. Then ultimately cesarean has to be done, and you know what is the problem with the child later. And once child is born, you have to take care of everything. You have to examine the child, and you have to see the weight, color of the child, and breathing, and see whether there is any depression in the anterior fontanella. Nose is, one's nose, nostril is small, one is big, there is a problem. Then there is a earlobe tear, there is a problem. There is a small mandible, there is a problem. Big mandible, there is a problem. Small tongue, there is a problem. Big tongue, there is a problem. There is a hole in the neck, that is a communicating esophagus with the trachea, and one feeding is enough to trouble the child. And one side of the thorax is normal, one is huge, protruded. That means pus is accumulated. Child is born only 1 minute ago, so it has to be drained. See the abdomen, it should be normal. If it is bulge, there is a problem. It has gone deeper, scaphoid abdomen, problem. So you can identify the child by 22 methods, by taking the child into the palm of your hand. The sister will examine, nurse will examine, say surgically she is fit enough. You have to turn the child and see there is any gap in this, and you have to separate the gluteal region. You have to see there is a anus, hole is there. Otherwise, it is called imperforated anus. If you feed the child, child may die after 48 hours. So these are all there. Why technically we are telling you is that you are the best people, whether you are future parents, you are already parents, and you are already a future grandparents. You have to know these things, and once you know, then you can always demand information from your obstetrician, gynecologist, and pediatrician, and to know the status of the pregnant woman, your daughter, your wife, and your child and grandchild. It is your right, but responsibility is that you have to know that some information, and information comes from only asking extra information from platforms. I already told you, like in medical, CME, CNE, CPE, and these conferences will enlighten you, give you lot of scope to learn for the future. Thank you very much for your patient hearing, and any queries you can always, I am always there to answer. Thank you. What is it? Oh, yes. Thank you for the question. And what is the context of today's session, and from which chapter schedule is made? So it is made out of obstetrics and gynecology, and it is made out of laboratory sciences, and it is made out of hospital setup, and also today's, I'm not talking about yesterday's, today's, and more importantly, the topics for which we address deeply is about anesthesia. There is a chapter there, and there is another chapter in the hospital lab, anesthesia, and obstetrics and gynecology. And we have already noted in the last two subjects neurophysiology. So it is about the stroke, some details, and neurosurgery about the injuries, head injuries, how it is treated at the roadside, how it is treated in the hospital, where operations are needed, those things, and especially this today's casualty and emergencies, the team which is equipped at the casualty and functionality attached to each one of them, and what are the function of the casualty, how they have to make a preliminary examination, make a first diagnosis, and save lives, and then disintegrated into particular departments where it has to go, medicine, surgery. In the casualty, it will be segregated. Along with that, I have already told, in casualty and emergencies, we segregate whether it is a police case, medico-legal case, and non-medico-legal case. And medico-legal case is a drowning, it is a hanging, it is accidents, and it is a murder, right? Road traffic accident. This will be segregated, and documentation is done and send it to a particular department. They will take care of according to the duration of the treating the disease. Apart from that, we have already told you about the institutional setup, what are all the departments existing, how the unit is functioning in youth. For example, if you take, because a specific question, what to write in the examination is that in hospital setup, we have got departments. Say, for example, medicine department, we have got head of the department of medicine is the chief. Underneath them, 3 units are there. The 3 units, and they are called unit chief. Underneath them, there are 5 to 6 junior doctors and students of PG, DNB, or MD, and they will admit the cases from OPD. They will examine them thoroughly in the inpatient, and they investigate, they pinpoint the diagnosis, then treatment is given. So treatment according to the diseases and duration. After that, the final day, they discharge them, and then advising them what to do next, when to come back for re-checkup, what investigation they have to do before coming down. In surgery, after the operation, they advise them during discharge what not to do, why this disease has come, right? And then they give treatment for only 5 days, and after 5 days, 6th day, you will come back to the OPD and they review the cases. This is the pattern everywhere. This is the topic they'll ask. What is the setup in hospitals? So the setup is that in general hospital, each department will have units. Department head is there. They will have monthly meetings, and they review the patients, and when complication arise, they know how to address in the future. This is the usual procedures everywhere. So this is the chapters scheduled is hospital management, right? Then the school health, and then the departmental wise, then physiotherapy, we have detailed about it, and then department which has not come under this is submerged under health care. What we talked about, school health, is very important. Most important is the lab facilities available in the setup. So whether it is hematology, biochemistry, pathology, microbiology, I have already given the diseases and also give an example how to do it, urine, whether urine, blood, CSF, and how they test this thing, and different types of anesthesia today's. And in OBG series, we talked about the gynecological, and the obstetrics. Obstetrics is pregnancy. And last but not least, we talked about the other parts of medical which is not there in your chapters, but important one is, I told you, it is malaria, filaria, leprosy, and most important thing which has left out is health, student health or school health, which has to be incorporated in medical setup anywhere. It is not hospital alone. It is primary care, secondary care, tertiary care. All these things should be answered. Question may be anything. What are the facilities available in the tertiary level? So it is hospitals. It is corporate hospital. So the primary health care, primary health center, and dispensary. So it is secondary CSC. So tertiary, it is specialized, it is super specialties, it is catering system will be same. But all that you have to know, wherever you go, these lab facilities and the health education and identification of the disease is same. So early diagnosis, early treatment, early referral is the cornerstone of the health system. This has to be completely on. Whether it is in the community, you diagnose as early as possible. If the disease becomes a late stage, so it leads to a lot of morbidity and mortality. But for that also, we have got answer. And I told you in HIV, so if you treat HIV, easy to treat. AIDS, we have got treatment, and opportunistic infection. It is all community. It is all community, primary care, it all different diseases. But it has to be addressed under same thing, that is hospital care and laboratory facilities. Thank you. ಹೌದಮ್ಮ 1 o'clock ದಿನಮ್ಮ ಆಯ್ತಮ್ಮ சொல்லிடலாமா Thank you for your patience listening. Thank you very much. So any queries, so my name is there with your this thing, and also my phone number. I am already working in private sector as well as in government. I was with government for 34 years. Then I, as a deputy director and director of health. Then I also director of Ayush and deputy director of ESI. Then after retirement in 2006, I became CEO of St. Joseph Clooney Hospital for 16 years. So there is only administration and appointing the doctors and how to fix the operations and talk to the public and preventive aspects. And I'm also conducting medical program for all doctors second Sunday every month for 17 years, and nurses first Sunday GH nurses, third Sunday MH nurses, fourth Sunday for pharmacists. So far, because of COVID, we have stopped it, and I am doing this medical education for last 17 years. Thank you.
Good afternoon to one and all. I hope I'm visible and audible to everyone. Can you hear me? Can anyone answer me?
Yes, ma'am, you're audible.
Yeah, thank you for your response, ma'am. I think less members are here today anyway. As per schedule, um, we can start our session. And today we are going to discuss about two topics. One is the Tamil Nadu Clinical Establishment Act, and another one is about the medical ethics. So we will be discussing these two. And before starting the session, I would like to thank Dr. Chenupati K. Ramaya, sir, Doctor, Director, Directorate of Distance Education, and Dr. V. Gopal, sir, Principal and Academic Register for Mother Teresa Postgraduate Research Institute and Health Sciences at Pondicherry, for giving me this opportunity to share my views about all the topics what is allotted to me. Thank you so much, sir. And we'll be going to the session. And is the slide is visible? Mm, I hope it is visible. Um, Please let me know if the slide is not visible or if it is not moving. Hello?
Yes, ma'am, it's visible.
Yeah, thank you, sir. Yeah, thank you. So we are going to see about the Tamil Nadu Clinical Establishment Act. So clinical establishment. So this act came into the force very lately around 1997. Before that, there is no strict rules about clinical establishment, how clinic should be, how normal dispensary should be. There is no such rule before that, and it is not strict to follow any minimum standards. But after facing a few issues and few problems, our government has framed this act in order to give minimum means minimum facility for the patients who are visiting this clinics. So according to this, all the clinics means we all know that we have a lot of Indian systems of medicines are available. According to um, the current practice, what is going on in Tamil Nadu, we have a lot of practices like allopathy, yoga, naturopathy, Ayurveda, homeopathy, Siddha, and Unani. And we all know very well about allopathy than that of the other systems of medicine. And according to this act, uh, the clinic, whichever is based on any of this system of medicine, should follow those rules and regulations. Whether it may be a person who had finished his MBBS or MS or MD, or who has completed his BSMS or MS, everything, they have to follow these rules when they are setting up a separate clinic way in order to treat the people or to diagnose the people or to consult the people. So this normally we all know that these clinics, the hospitals, they are usually they are only for consultations and for any emergency purposes we can be using it. And when they want to when the patient want a continued treatment, they have to go to specialized hospitals or separate any departmental hospitals or clinics in order to get their treatment. And I hope you know the differences between these systems of medicine. Allopathy is the normal, means what we are getting means it consists of it's a system in which the doctors and the other healthcare professionals are treating the symptoms and diseases using drugs. Drugs means in terms of synthetic, semi-synthetic, or any processed kind of drugs, or any kind of radiations, or by surgery. So this is the majority of the system, major system what our people are following now. Other than that, we have the other systems like yoga. This also nowadays it was very trendy, and everybody they are trying to um, follow this in order to keep their mind relaxed and body relaxed, which was very peaceful, and we are able to focus on the other works or any other thing what we are doing in our life. So that involves actually the breath controls that will be relaxing our mind and our body. So it is also an ancient system of medicine, but it has some complex practice. Means uh, a person has to do yoga continuously in order to get a fruitful effect in our body. So it was actually rooted by the Indian philosophy in the past, and it is actually not only the science; it is also an art of healthy living way in our life. So next one is naturopathy. So it is also an alternative system of medicine for allopathy. So where this diseases can be treated, prevented without the use of drugs. So this is to allopathy actually, where we won't be using any kind of drugs. Only we will be doing any, we will be following some diet, or we will be following certain exercises or massage therapy in order to cure the disease. There is no use of any kind of synthetic or natural drugs at all in this system of medicine. So it is a system where we can go for self-healing mechanism, means it is going for self-healing. And after learning for a few time period, a person can do this all alone without support of anyone, and throughout his life in order to have a healthy body and mind. So it will be based upon maximum majorly it will be we will be following some exercises, uh, go for stress management, and we'll be following some healthy diet and exposure to the sunlight, and waking up early in the morning and using fresh water, fresh air. So these are the components where we'll be using the naturopathy in order to treat a disease also, and also to prevent a disease. So next is Ayurveda. So it is the combination of normal practical food diet, and along with herbal treatment, and also with yogic breathing to treat illness. Means a certain kind of breathing like inhaling and exhaling will be involved in this Ayurveda, where along with the diet, herbal foods we will be taking. So it is the actually treat disease by giving the drugs in a very small amount. So few drugs, when we are taking in a very large amount, that may cause some disease in our body. So they will be choosing such kind of drugs, and they will take it in very small amount, and they will dilute it as much as possible, and they will be giving that to the patient. So the concept of this homeopathy is almost like vaccine therapy. We all know that we will be taking vaccines of in vaccines we will be having live microorganisms or dead microorganisms in very very minute level, which will create immunity in our body. Our immune system will be boosted uh, by this kind of treatment. So homeopathy system, whatever may be the drug, whatever it may be a synthetic one, but mostly we will be going for natural and herbal drugs, and but we will be using them in a very very diluted and small amount that may cause disease if we are giving in large amount. So that is another system of medicine. When it comes to Siddha, it is another ancient system of medicine which has been originated from South India only, and um, according to this, our body is made up of, our body is consisting of five elements. We all know that, like Panchabhuta, earth, fire, water, air, and space will be involved in this. So, based on that, three senses, which is very active in our body, will when it loses that balance of these three senses, obviously that is we are getting a disease. According to Siddha, when three balances, these three senses are Vada, Pitta, and Kapha. I hope you all would have heard this. So Vada, that is related to space and air. Pitta, that is about the heat or fire in the body, and Kapha, it denotes the earth and water. So when these three senses, when they are unbalanced, according to Siddha, we are getting some diseases. So balancing them, that is the treatment in Siddha is given by balancing these three humors or senses. So last one is Unani. So this also is based upon senses. So, but in Unani there are four senses, so that actually, like four kind of fluids which are available in our body. So that is being, when they are not secreted, or when they have some infection, we are getting some diseases according to Unani system. So those four senses or fluids are blood, phlegm, yellow bile, and black bile. So when these four senses are getting disturbed, we are getting disease according to Unani. And Unani system is very much, very very rare in our country, but it was from the medieval Muslim physicians have formulated this kind of treatment of disease. So, but we can see all this system of medicine, like allopathy, yoga, naturopathy, everything. We can see these kind of uh, clinics everywhere. But allopathy, allopathy consultation hospitals or clinics are more when compared to that of others. So, apart from this clinics, we also have this laboratory, medical laboratories which are analyzing our blood for pathological, chemical, and diagnostic services. So those laboratories also should follow this Establishment Act. So according to this act, this kind of laboratories or this kind of clinics which are following this any system of medicine can be owned by any single person, or it may be owned by any trust of people, means any members of board of people, or it may be owned by any government. So all this clinics has to follow this act according to this. The only exception for this only executive department for this act is armed forces, means for example army people or army, according to Indian, according to this act, Indian military or Indian army, if they are following, means this kind, if they have framed or started a clinic of Indian medicine, those clinics no need to follow this act. So there is an exception only for that kind of people, not for the other one. So state government also has to follow this, central also has to follow this act, and we are going to today we are going to see about only the act which is applicable for Tamil Nadu. So this act was first introduced in 1997. After that, it has been revised many times, and in according to our system, according to this act, the central government has provided certain rules and regulations for following clinics, and from that rules and regulations, our Tamil Nadu government has framed a set of rules and regulations for uh, keeping a minimum standard or minimum facilities of a clinic to patients. So this act is applicable for both therapeutic and diagnostic types. Therapeutic is for treatment, diagnostic only to analyze what is the disease. So whichever type may be the clinic, they have to follow this act, including this public and private sectors, and including all system of medicines. Next is the members of this act, means our the state government has given a set of people to give an authority to give some permissions or approval for such kind of clinics. So those members will be the registering authority will be the district health officer and chief medical officer. These two persons are solely responsible for giving the approval for the registration. Either it may be a provisional one or it may be a permanent one. These two members are solely responsible for giving the registration permissions. Other than that, we have other members like district collector or district health officers and any other three members that as per the regulations, any other three members in the field of our medicine can be allotted as a member of this authority, which is called as district registering authority. So they will decide the rule, means they will decide whether the clinic can be authorized or unauthorized, or whether they will be checking, they will be going for an any other checkups or any sudden visits in order to check whether the clinic is running as per the rules or not. The next is the purpose of act. Why we need this act? So, why we are making it compulsory for all the persons who are starting a clinic means the treatment levels are totally different. Means the minimum standards are very low in very few clinics. So, in order to make them equal, in order to make that every patient who is approaching a clinic should get a minimum standard of treatment, which will be improving their health. So that's why we need, excuse me. Hello. Yeah, sorry, there was a disturbance here on my side. Sorry for that. We can continue. So we were discussing about the purpose of act, why we need this act actually. So in order to give standard treatment for the patients, all the clinics should have some minimum standards, and government was very keen and strict about it. So so the government has proposed this act so that all the clinics should follow those rules and regulations. And this registering authority, district registering authority, they will be going for a checkup, or they will be going for any visits in order to find what kind of treatment is going on, and what is the standard of treatment given by the doctor to the patients, and the treatment levels. And if just in case if they are not following the rules and regulations of the act, and about the hygiene, or about any the way the patients are being treated, or about the fees what they are charging to the patient, everything will be included in that. When these authorities, when they are finding any mistakes from the side, from the doctor side or the clinic side, they can even impose fines. So that is another purpose of this act. So next is, uh, based upon this act, there will be general treatment guidelines can be framed. So before this act, um, all the doctors, they are treating the patients on their own, and there is no guideline for how for treating a particular disease or any special kind of disease, how to treat them. What is the minimum way of standard to start with the treatment for any severe kind of disease. So after this act, all the diseases, for all the diseases, they started preparing general treatment guidelines, so that all the doctors will be following that kind of they will be getting a good better treatment. So apart from this, um, so even we have now in our current scenario also, we know that emergency cases are not being accepted by very not very few, many private hospitals. So in order to avoid such things, so many acts are being bills and acts are being passed, but still practically not all the hospitals are accepting this accident cases or any emergency cases. So in order to avoid those such kind of issues or deaths, clinics are not accepting that accident cases. So that is also one of the reason why this act is being passed, saying that all the clinics, or either it may be any system of medicine, they have to accept the patients who are approaching them. So if it is a medical emergency, it may be a medical emergency, or it may be any person who want to stabilize their situations. Even though the clinics don't have any specialized equipments or any other, can at least try to stabilize the patient, those accident patients to the any other nearby hospitals. So it will be helpful for the patient to save the patient. So in order to maintain all those also, this act was being proposed by the government. So next, minimum standards, what they are expecting according to this act is, so they need a minimum staff requirement, and in a clinic, whenever we need we go, now, apart from this medical persons, non-medical persons, how many are working, all there also should be considered based upon the type of clinic what it is, and they have to keep the records of all the patients at least for a few time period as proposed by the law. I think it's up to 3 to 5 years based upon the case scenario, and they can be reporting if it is any they can report about that case if there is any legal issues or any legal need for the patient. And minimum levels means, like if we go to clinic for an emergency purpose, a minimum set of drugs should be there, a minimum set of equipment, surgical or any wound healing, any other instruments should be there. So similar wise, they are having a list of things which has to be ready in a clinic, so that it can be given, means it will be useful for the patients to get treated. Next, the objective of this act is, in order to maintain the registry for clinical establishments. So before this act, there is only the government has had only an approximate level of approximate number of the clinics which are available in the country. So once this act passes on, there will be an accurate number of the clinics. The government will have accurate number of clinics what are available by like area wise or district wise and state wise, so that we can have a digital registry and we can know the history of a clinic, when that clinic has been started, who is the sole proprietor or responsible for the clinic, and who all worked in there. Even if a doctor resigns or he don't want to work anymore in that area, some other person will be taking care of that clinic, and that also will be followed in that registry. So the whole history of that clinic can be digitally saved, so that in order to have an idea how many are running clinics like privately or publicly, against or within the rules and regulations. So that is the main objective of this act, and we can avoid quackery of the practitioners. Means we all know that few persons, means with a fake certificate they are being practicing. Means when we are inquiring, we will come to know that the patient has worked in some other clinic along with the doctor, like around 10 years or 15 years or 20 years, and later he himself or she herself would have started a separate clinic without any certificate. It means it is only with purely only with the experience they got a confidence to start a clinic, and they are trying to treat the patients. That is actually the so unqualified persons who are practicing only based upon the experience what they have. So that is a fake kind of thing which is going on now and then. We can see that in news. So in order to avoid that also, this act is being proposed. So next, in order to improve the quality of healthcare, means we can see even now, I can say that even now many banned drugs of other countries are running successfully in our country. So that will actually it will affect the standard of or the health condition of the person, as well as the standard of our country. So those banned drugs, even after knowing it was banned from some other country, it is still even being sold in our country. So that can be avoided. So that is, if it is officially, if they are selling it officially, that will come to the knowledge of this council or the registry according to this act, and they will take actions. So all these standards are prescribed for the clinics and the dispensaries or medical labs or whatever, and except the teaching hospitals, because teaching hospitals will be having a separate rules and regulations which they have to be followed. So they won't come under this act, teaching hospitals. So next one is the procedure for the registration of the clinics. So after the act is being passed, after getting approval from the assembly, when it comes to act, after that no person can run a clinic without getting it registered. So after 1997, we can have it like that. After 1997, no person can run a clinic without any registration. So you can see in any clinic, if you go to a clinic or a hospital, you can see their register, their council certificate also will be in a display, and the clinical registered means the clinic registered certificate from this establishment will be displayed in the entrance or in the front of the office. So in order to prove that this has been registered, the doctor is a registered medical practitioner. So we have to they have to follow that. So for this they have to apply in the prescribed format, with all the details what has been asked for about the establishment types, means the even the constructions and blueprint, including the type of the service and what is the system of medicine and what kind of medicines they will be using and what kind of minor surgeries can be done there, or any other rehabilitation services or counseling part will be done in the clinics. Everything should be mentioned as per the rule. So when you go for registration, we have two kinds of registration. One is provisional and another one is permanent. So provisional registration and this permanent registration. Before going for this permanent, we will be getting the provisional registration, and for that the person has to submit the application either by in person or they can send it by post or online. They can submit online along with the necessary fee to the authority, district registry authority, the person to the persons, and they will be deciding after that. So when you come to this provisional registration, so this registration will be given immediately, means within 10 days of application date, this provisional registration certificate will be given to the clinic. Without conducting any inspection or without any visit or inquiry or anything, provisional registration will be accepted, and the proprietor of the clinic will be receiving the provisional certificate. And this registration is valid up to around 12 months from the date of issue, which is renewable one. Means, for example, if we are applying for a clinic now, it is May 11, and within for example, within 10 days, if the provisional certificate is being issued to us, around 21 May 21, we will be receiving the provisional certificate. So that certificate is valid up to next 12 months, means up to next April 21 it will be valid, and this can be renewed within 30 days before of the expiry date. Means before March 21 we have to go for renewal application unless until it is permanently registered. So we'll come to permanent registration next. So when you go for a provisional certificate, it will be provided within a period of 10 days after the application, and it is valid up to 12 months, and it is renewable also. But if you go for renewal, we have to apply 1 month before, means in the 11th month itself we have to go for a renewal application. So coming to permanent registration, so after receiving the provisional registration, the person, the doctor can run a clinic. So in between, the authorities, this district registered authority, they will be conducting an inspections, or they will go for a visit and inquiry, and they will check about all the standards what they have given in the application is meeting the standards of the clinic, really practically whether they both are meeting as such or not. They will be checking everything. So after the inspection, when they are satisfied, when the registry or the inspection purpose inspectors are satisfied with what they have given in the application is okay with the practical clinic, they will be displaying this information to the public in a notice board. And public can give an objection for this in case if it is not if it is a fake one, or if they have any doubt, if any person can object it saying that this clinic is not following this rule, this clinic is not having such provisions. In case if they have a proof and if they have a doubt, they can go for objection. And if there is no objection, or even if there is any objection, and if the clinic can is able to prove all the facilities what they have, the authorities will be satisfied, and they will be granting the certificate of registration, of permanent registration, that will be valid for a period of 5 years only. So provisional registration is valid only for 1 year, for 12 months, and permanent registration from the date of issue, the clinic will be having validity only for 5 years, after which they have to go for a renewal. That's it. Next, penalties under this act. So according to this act, all the clinics should follow those provisions and rules and regulations. Just in case if they are not following, this district registering authority are capable of posing penalties to that clinic up from 5,000 or 10,000 up to maximum 5 lakhs, depending upon the severity of the offense. So that is a separate column that saying about what kind of severity will be having fine. But it's very clear that there is no imprisonment for this act. Only fine will be imposed for the persons based upon what offense they are being doing. So now we will be seeing about all the exact rules and regulations as prescribed in the Act of 1997, which was recently updated at 2020. Means it has been revised again and again based upon the. It has been revised. So the first one is as per this act. The name of this act is Tamil Nadu Private Clinical Establishment Act 1997, and the whole state of Tamil Nadu has to follow it. And this will come into the force as the government notifies. Means where it came into act in 1997. So according to this act, competent authority means the persons or the officer who is being appointed by the government to do the duties of that act. So actually, this competent authority is not will not be confined to one person. So as we saw already, that district registering authority is the competent authority. Like chief medical officer or district health officer will be involved in that, solely responsible for giving this provisional and permanent registrations. So they are called as the competent authority, and other persons like members, whomever being appointed as per the act, they are called as competent authority. And the government here, it means as a state government for Tamil Nadu. And if it is following the central government, that is act in that act came into process at 2010. So this includes this private clinical, the word private clinics, it will be involving a general hospital also, maternity hospital or dispensary. And if it is general hospital, there will be certain set of regulations. And if it is maternity hospital, there will be certain set of regulations and rules and the list of chemicals which has to be available. And if it is a maternity hospital, obviously operation theater must be available, and all the needy necessary things should be available. So if it is a clinic, there will be different kind of rules. Dispensary or general hospital or maternity hospital, everything will be in different way. So or else this private clinic may be an institution or a center where it will be treating only the very small ailments, treating for small ailments or mentally sick peoples or only injured peoples with or without any post-operative procedures. That also will be coming under this private clinic act. And the other centers like diagnostic centers, radiological, such as this ultrasound diagnostic centers or X-ray centers or any medical laboratories, or the centers which will be getting medical equipments. So everything also will be coming under this act. Next is this is what we have seen it before. Like for registration, we have to all the clinics should be registered according to this act, and within 3 months of act which has been commenced, within 3 months of commencement of this act, the clinic should have been registered completely, and at least they should have provisionally registered. So if they are after crossing 3 months also, if they are not getting provisionally registered, either fine will be posed for that clinic, or else they can see the clinic by seeing the facilities or the standard of the treatment what is given in that clinic exactly. So without the number of prescribed manpowers or the list of equipments or the specialized services, without giving the list and data in detail, no clinics will be registered. So any clinics which has been started, they have to get a provisional certificate within 3 months of this act. So next is a certificate of registration. So obviously we saw this before about this provisional and permanent registration. So only if that competing authority is satisfied with all the things, there will be all the rules and regulations followed by the clinic. They will be giving this certificate of provisional or permanent registration, and the authority is having the rights to reject any application, but they have to list out the reasons why they are being rejected, and it has to be recorded in writing, means it has to be documented, but they have the rights even also to reject the clinic. And if it is approved, if the clinic is being approved, it is valid for 5 years and it has to be renewed when they are nearing this expiry period, validity period, they have to go for renewal process. And just in case if the doctor or the clinic is losing the certificate, they can be a duplicate certificate can be obtained by proving whether they have lost or destroyed by any other unexpected problems or damaged, by proving that this clinic or the doctor can get a duplicate certificate, and they have to pay for that. So next, coming to the suspension and cancellation of registration. So at what conditions the registration is being cancelled is by means the competent authority, they have the rights to issue a notice or on its own or on behalf of the person who anybody, if they are complaining to the competent authority about a particular clinic also, they will take action, or on its own also they have right to take the action, and they will be issuing a notice to the clinic showing the cause why they are asking to cancel or suspend the registration for a period of for a period of time. So they have to mention the reason why the competent authority is trying to suspend or cancel the registration, and the reasons should be documented. So after issuing this suspension or cancellation issue notice, the clinics or the private clinical establishment or the persons who is a sole proprietor, they will be given an opportunity to prove themselves, so that whether the reason what is quoted by this authority can be changed, or they can change the rules and not the rules and regulations, they can change what has been being prescribed as a wrong by the competent authority, or they can prove that they didn't breach the rules, or they didn't overcome or bypass the rules. And after getting that statement from the clinic side, if the competent authority is satisfied, they can approve the registration, or else they can suspend the registration of the clinic for a particular specific period of time, saying that within this time period, you have to do all the changes, and you have to means the clinic availability should be there with minimum this standards. So this registry is having the rights to suspend the clinic for a certain period of time also. So next is a competent authority is also having rights, like without issuing a notice also, all of a sudden suspend or cancel the notice, saying what is the reason, what it is in document in writing. So at when any unexpected reasons, or when the clinic is has undergone any offense, very serious offense, which may be a lethal one, or which may be is not good for the people in the future, this competent authority is having the right to issue a notice. Without issuing a notice, they can go for direct suspension or cancellation for specific period of time, or a permanent cancellation. So next is inspection or inquiry. So this authority, competent authority, has the right to go for an inspection without prior information. Also, they can check all the places in a clinic, like buildings, laboratories, equipments, or whatever, and they have to communicate to the private clinic saying that they have to go for this kind of changes. They have to go for this kind of changes in order to avoid the cancellation or suspension of the clinic. So this advice will be given to the clinic, and the clinic has to follow those rules and regulations, and they have to give an another report saying that after making all those changes which was prescribed by the competent authority, that can be along with the proof that can be submitted again to the competent authority, and those explanation, if it is satisfying this competent authority, the authority will be approving it, and if they are not satisfied, they will be rejecting, advising some other action to be taken. So this time period of issuing a notice and giving an explanation from the clinic side, these all kind of things should be done within a reasonable period of time, means which will not affect the patients or the nearby surrounding people's for getting treatment, and but it has to be satisfied in the competent authority. So next one is appealing. So if the clinics, if they are aggrieved by an order or the rejecting order given by the competent authority, they can directly go for an appeal within 30 days from the date of receipt of order. Means if they have a proof that they are following the rules and regulations of this Tamil Nadu Clinic Establishment Act 1997, they can go for an appealing for the rejection of the clinic within 30 days, and they have to give everything, all the proof and their side of explanation, everything in documents. They have to submit along with the documents. Next is the punishment what is given to the clinic side. So that also we have seen already. So like minimum 5,000 to 10,000 to 5 lakh rupees. So with no imprisonment, only they will be imposing the fine for the clinics in case if they are not following the rules. And for that also, the competent authority should submit the reasons why the fine is being imposed, and what is the purpose, and why they are quoting that particular amount of fine, because it will be from 5,000 to 5 lakhs. There is a lot of difference. So if they are quoting particular amount also, they have to say the reason why that amount is being quoted particularly. So next, offenses by companies. So we saw it before that a clinic may be owned by a single person, or it may be owned by a team of trust members, or it may be from the government. So when this act is finding some person, some clinical person is doing an offense, then the offense will be targeting, or they will be informing that company in charge will be deemed to be the guilty. So just in case if one person is the sole proprietor of the clinic, then that person will be deemed to be guilty, and he is supposed to give explanations, and he is supposed to pay the fine if it is imposed. So he will be punished legally actually. So in case if there are a group of persons, or the persons who are working under the sole owner of the clinic, means for example, if a clinic may be owned by a doctor, and there will be some non-medical staffs also will be, or a hospital, in a hospital also they will be working. So if that offense has been made without the knowledge of the owner, then the owner has the rights to prove, saying that that offense was committed without their knowledge, and they have to prove it. And the owner, they tried to avoid, to prevent such offense with all respect. So if he is able to prove that, then the offense will be um, given to the person, the who is the particular person who is responsible for that offense, like either director or manager or secretary, who they will be deemed as guilty only if the owner is able to prove that it was not his. So that particular person will be deemed to be guilty, and they are supposed to pay the fine, or they have to give an explanation to the committee why that offense has been commenced. So here, either individuals, the word individual means that the people who work under the management, under the trust, and they have been appointed, either it may be a manager or a supervisor or secretary or anybody. And company, the word company means that owner of this clinic, or a team of members, board of members for the hospital. So they will be responsible for any other offense until unless they prove that it is done without their knowledge. So the next one is cognizance of offenses. So we have been discussing so far about the competent authority and the clinic, or the hospital, which the owner of the hospital. So just in case if issue that offense was very serious, and if there has been some action officially by court, then without means no court, means none of the court can forcibly offense uh, any authorized officer, unless until it is the complaint is being made by the competent authority. Means no court can take action on any person about the clinic until this competent authority persons, or the officially authorized persons, are complaining about him. Like how excuse me. So like how and a competent authority is having rights to take action on its own, the courts are not having the rights to take action on this own, on this act, particularly only in this act. So the court can punish a person only if the complaint was given by this officially authorized person or the competent authority as prescribed by the Act of 1997. So this is what that means. So next, protection of action taken based upon the autonomy, like good faith. So if any person is trying to do good, means they are trying, their actions are intended to be good, but it came out, the output was some output was like some issues or problem or any other offense, then they are allowed to explain themselves, and they shall not be prosecuted, and there will be no action on them. So if they are able to prove that they started a cause for good, which will be in future, which will be helpful for the patients or the public, but that was ended up with some offense, and if they are able to prove that they did with good intention, and they cannot be prosecuted, or there will be no legal proceedings will be there on particular persons. And obviously this competent authority should approve that that person has done this with a good faith, but it has ended up in some other issues. And no one can suit a law, means they can sue this government against this law, saying that because of this act they are being affected. Because for example, when we are going for this road expansion thing, when the government is planning to go for road expansion, obviously they will take up all the shops or the houses which are nearby the road, and the persons, the public persons, they are supposed to sell that to government, and government will fix a rate according to that, actually. So that is for a good action, actually. That is for a government is trying to do good. It is meant for a good faith, and so that no persons can go and apply against the government. So similarly, any persons who are doing any uh, any actions which is trying to be in good faith, and they can't go for filing means suing against the government, saying that this is not done for the good faith. So there will be no legal proceedings against the government, even if it is causing some damage to them, and the government would have been proposed that action for some good thing. So that has to be processed. The next, furnishing of returns, means when a clinic is trying to get a provisional or a permanent registration, they have to furnish all the details about the clinics, about the persons, about the chemicals and list, everything in return. That too in prescribed time to time, means when they are going for provisional registration, they have to give all the details, and while coming for an inspection, they have to provide all the details, and after getting permanent registration also, it is valid only for 5 years. So when they are going for renewal process also, they have to furnish all those details and statistics in written to the competent authority. So all the persons who are working under this act, means the competent authority members or any other persons, or they have to be treated as a public servants, means government servants. They will be treated as the government servants. Next is the power to make rules. So who is having the power to make rules under this act is only the government. Only government can change a rule, or they can cancel a rule, or they can modify the rule, or they can nullify the rule. Only the government is having rights to go even for proposing for the change of rule, or cancellation of rule, or nullifying the rule. And for that also, the government has to propose the reason to the table of legislative assembly, and that legislative assembly will inquire, and they will discuss, and they will come to a final decision. And only if the legislative assembly is approving it, the rule, a new rule will be coming into act, or into commencement, or any other rule will be changed, or any other rule will be nullified. So government can propose, and the legislative assembly is having the rights to either to approve or change or nullify. The last one is the power to remove the difficulties. Means, so the government has proposed a lot of rules to the clinic, and if those rules is causing any difficulty for any person, or if the persons who are working there, if they are feeling some difficulty to implement the rule, then those difficulty can be removed by the government with appropriate application and approval. So the government can do anything to implement that rule, or to remove the difficulty to implement the rule, or the persons, the government is having the rights to take action on any person, or they can do anything to implement this rule of Tamil Nadu Clinics Act 1997. So that's it. So because of this rule, our system has been established and grown a lot, and the government has got, the public has got a lot of quality services, and the government has got a lot of establishment with digital registry. So this comes under the Tamil Nadu Clinics Act. So if you have any doubts, You can let me know. Do you have any doubts? Yeah, and in the chat box, yeah, about Deepti's question. Yeah, in your syllabus, actually, bed planning is only covered, but it was a small topic. And to gain more knowledge about the bed management system, I have added up all those extra instructions and extra things for your to improve your knowledge. So only bed planning was there in your syllabus, and I will send the PPT. You can discuss with the coordinators. So if anybody is having any doubt, please keep it under the chat box. And I'll take a 5 minutes break to come back and we can start with medical ethics. Thank you so much. I'll be back in 5 minutes. Good evening, all. Thank you for waiting for me. So we can start with the next session about medical ethics. I hope you can see it and it is visible. Slide is visible. In case,
Yes, ma'am.
uh, just in case if you need any assistance, please let me know. So generally, um, when you come to any profession, we will be talking about this ethics. So ethics that matters the most when you go for a profession, either it may be a medical one or it may be any other mechanical or engineering or any teaching profession or administration, whatever it may be. When it comes to a profession, ethics are very much important. So they have, and particularly when you go for a medical profession, ethics are very much important so that it won't affect the society or the patients or they themselves or their family. So we are going to see about the ethics in detail now. So it was derived, ethics, the word was derived from the Greek word, which means actually habit or action or a character. So actually it is a conceptual thing to evaluate and guide the moral decision making. So whenever a physician is taking a decision, they have to think in all the ways which will not be affecting the future of himself as well as the patient. So they have to go for a moral decision making. So it is a kind of philosophical belief and practice to find which is right or wrong, which has to be done or which should not be done. It was actually a large field, but it is a complex field which is having a lot of divisions and subdivisions and branches of it. So when you come to the professional ethics, so each and every profession has a certain set of code of behaviors which has to be followed by the particular member or the stakeholders, which will not affect the dignity of the profession, which will not affect the dignity of the physician or even the dignity of the patient. So when it comes to medical ethics, actually, so it is a system of values that which has to be given more importance by the physician actually. So they constitute the profession a lot, and they are the limelight. They are in the limelight, and if a doctor make a mistake, so that will be highlighted uh, it will become viral and it will be highlighted a lot and it will be discussed a lot. So they have to follow this rules and regulations very strictly, and that rules and regulations was also based upon the philosophies and morals. So that is what we are going to see about the medical ethics, so which has to be implemented in their practice. So it is a higher standard of behavior, and which requires the physicians to obey the laws and to avoid the unethical behaviors. So it should actually focus primarily on the issues which will be arising while they are practicing the medicine. So it is a methodology, so which is considered for implementing the technology and what the technology should be or what technology is already available and what should how a patient should be treated. It's also said as a principle which should guide the members of the profession in course of their practice while they are dealing the patients. It is greatly influenced by the development of human rights. Recently, very recently, this medical ethics are influenced by the rules and regulations of human rights, and a new ethic rules are being followed and it is being implemented. So this all the physicians has to frequently deal with this medical problems, which will be resulting from the violation of any human rights, or when they are forced for migrations, or even when they are made into torture. So physicians have to face such issues, and they have to follow the ethics when they are facing such issues. So coming to importance, so why these ethics are so important, because that will create a basic relationship between the physician and the patient, and when they are applying this new principles in some situations, they may cause some problems. There may be some issues between the physicians, patients, and the family members also, where the family members or the patient will not agree with the decision of the physician, but the physician has to convince, and they compromise, not compromise, they have to convince by explaining the situation what is the right way to act in that particular situation. So physician is having the responsibility to follow the ethics, and he has to explain that to the patients and the family members. So, and the physician has to recognize all the difficult situations each and every minute in their working hours. They have to follow this ethics, and they have to follow, they have to recognize that particular situation, and they have to deal with it in a principled manner, and they have to solve on their own. So that is very much important. And because of this medical ethics, the interaction between the physician with their colleagues or with the society, or when they want to go for any other research, that also will be improved. So they have to follow this medical ethics. So mainly, so when it comes to this intervention, medical intervention, so intervention is nothing but, in medicine, it is a treatment or a procedure which is done to prevent or to treat a disease to improve the health of the patient. So in order to do this intervention, these goals are being promised, or it is being believed that this medical persons will be, the medical treatment will be promising us that restoration of complete health, or they will relieve the symptoms, or the normal function, restoration of any organs, or the maintenance of the compromised, or the compromised function of those deterioration will be followed, and they will be saving and prolonging the life of the patient. So this medical interventions examples includes all the supports for this treatment, like oxygen, like ventilation, or any other tracheostomy, or etc., etc. And these goals, based upon the nature of the disease, it will be preferred for the patient, or it is preferred for the society. Based upon the culture and economic factors, it is being prescribed to the patient actually. So, when it comes to the ethics, what is the purpose of the ethics is, in order to frame some rules for institutional normal practice or policies, and in order to go for following the law which has been implemented in the country, or any other policy of any organization, separate organization which the medical person, means the doctor is being working, or any other standards like legal or trust obligations. So everything will be fulfilled when you are following this medical ethics. So next is the relationship between, means the aspects between this law and medicine. So they have four aspects when it comes to the interaction of this medical affairs. So first is legislation and administration regulation, why that should not be affecting the medical practice, means the doctor should practice which will not affect any rules, like based upon the legislation. And it should not practice against the judgment of the court, or any other problematic or controversial issue in the medicine. He should not work against it. He should not practice against it. And any other issues or any other persons may suit file a case when there was a malpractice, and if there is any negligence by the doctor also. And we can use this affairs, or we can use some treatment case sheets or discharge sheets or whatever, or prescribed papers or whatever. We can use it as an evidence in the court for any other medical issues, for criminal or civil proceedings in many problems like either homicide or insurance claim or rape or etc. So this is the aspects of the relationships between the law and the medicine. So next, coming to the scope of medical ethics. So the future scope of medical ethics is to develop the ethical practice and recognition of ethical dilemmas and the resolution of ethical conflicts and prevention of ethical breaches to avoid the breaching things. So when it comes to this development of ethical practice, so the doctor or the physician has to follow the principles of medical ethics. So that is nothing but the autonomy, beneficence, or the faithfulness, or utility and justice, everything. So that has to be developed. That basic principle of that medical ethics will be developed, and it has to be followed. When coming to the dilemmas, when there is a conflict between any two courses of action which are morally correct, means both of the actions are morally correct, and there was a conflict between that two persons, so that is called as a ethical dilemma, and that can be between either an individual and a community, or between the trust and loyalty, or between the justice and mercy, or it may be a short term or a long term one. So this kind of dilemmas can be recognized while we are going for um, recognition, means while we are when we are following this medical ethics. So this can be recognized and this can be ruled out, all this ethical dilemmas. So next, coming to the conflicts. So three principles like giving respect or the dignity to the particular persons or beneficiaries and the justice. These three principles has to be followed, and it has to be interpreted. And if not, when there is a problem, or when there is an issue to follow these three principles, there will be some issues, conflicts arises, and that conflicts can be approached either by accommodation or collaboration or any avoiding. We can resolve those conflicts by any other approaches. So we can go for resolution of those all these conflicts only when we are following this medical ethics. The next is prevention of ethical breaches, means to avoid the breaching of or the violation of the law. So in order to avoid this breaching, the person has to honestly assess the needs, means the physician has to honestly assess the patient's needs and resources. They have to establish a very good foundation, and they have to build a good integrated culture fully where they are working, and they have to keep focused values on all the moments, and they have to reevaluate and revise whatever they need. So when they are following all those ways, obviously these breaches can be prevented, means these violations can be avoided. So next is components of medical ethics. So all this where the medical ethics will be violated, means only when there will be a issue between this relationships, like relationship between the doctor and the patient, or the relationship between doctor and doctor, or relationship between when the physician is not following to that of the system of healthcare, means when they are not following the law of health system, or when there is a the problem between the relationship between the physician and the society, there will be some violations or breaches. So these things has to be followed. Means physician, when the problem is arising between physician and patient is when there is an unnecessary consultation. So that has to be avoided, means which will be either unnecessary consultation can be avoided either from the physician side or the patient side. So if not, that's a time waste and they may cause some issues also. And punctuality should be maintained between both of them, and fees and other charges should be clear, and the statement that has been given to the patient after the consultation should be very much clear and convincing from the physician side. So when they are not when there is breaching in all these areas, obviously there will be an issue between the physician and the patient. So then it's coming to the physician and physician relationship. So there must be some understanding and there must be dependence on the physician on each other, at the workplace or even if they are not working together. So because of the same profession, they have to have some dependence and the understanding between each other. So it should be considered as a pleasure or a privilege, so that they can avoid the remarks upon the diagnosis or the treatment of the other physicians. So actually, when one of the physician is giving bad remarks about the diagnosis and treatment of the other physician, obviously that's a kind of um, unnecessary thing, which will be causing some issue between the physician and physician. So as per the moral medical ethics, so a physician should not comment on other doctors treatment. So next is the relationship between the physician and the system healthcare. So the physician should participate in a regular basis to improve or to validate the quality improvement initiatives to bring the meaningful change in the healthcare system. So they have, it's a social service obviously. So they have to, apart from working atmosphere, they have to go for some meaningful initiations which will be doing good for the healthcare system. So next is the relationship with the society. So that the physician should educate. They can educate the patient, family about or the relatives about the disease or the diagnosis and the treatment. So they can, when a doctor is explaining about a critical situation, obviously, so that will educate the other persons. So that is actually one of the ethic, means when a patient is going for a treatment and if they found him with a disease which is unknown to him, so the physician is having the responsibility to explain about the issues, problems, risks, treatment, everything about the disease to the patient. So that relationship should also be maintained. Next is to about the duties of the physician. So obviously they have to help and service the humanity, and for this they need the patience and delicacy should be needed to characterize the physician. They must patiently hear the case history or any complaints what is being given from the patient, and they should respond to the patient accordingly. And if there is when a patient is approaching a physician in an emergency case, then also the physician should hear from them and they have to respond immediately to treat them. So next is to protect the promote and protects the patient health, and next to maintain the confidentiality and privacy of the patient. So this secrecy of the patient should be maintained for the physician unless until it is required by the laws. Means in case it should not be disclosed to any other person. The patient's situation, like any about their treatment or their health condition, should not be disclosed to any other person unless until it is being required by the law of state. So And that law also should be for protecting the health of individual health. Only then the physician is supposed to expose about the condition of the patient. And next is to maintain the records, and they have to be and the statements in the record should also be informed to the patient, and minimum up to 3 years to 5 years the record should be maintained by the doctor. And only if any legal authorities are requesting about the records, they can disclose about the records, that too within 72 hours they have to report. Next, about the patient's autonomy means autonomy means freedom, which is or the choice which is given to the patient to choose their physicians. Means they are not being forced. They should not be forced to take a treatment under a particular person's. So they have the full rights to choose their own physician, and just in case if they are if a patient is selecting a physician, and if the physician accept that case, he should not neglect the case for any reason until the patient being treated. So next, to uphold the dignity and honor of his profession means he should not do anything against the respectfulness of the profession. Next, the physician has the rights to inform the status of the patient to the patient or relatives, just in case if needed, in a very clear statement. Means prognosis, the diagnosis, or what is the patient condition, that should not be that should be disclosed to the patient, and it should not be minimized or exaggerated. Means they have to explain only the exact situation. So they should not scare the patient or the relatives by saying about the severity of the disease, and they have to explain about the risk of the treatment. Everything should be informed to the patient. So these are the duties of the physician. So next, what are the rights that are given to the patient according to the medical ethics? So each and every person in this society, they have the rights to get the quality medical services. Quality medical services, so they can choose their own doctors, whomever they want to get being treated. So that is one of the fundamental rights of all the patients. So next is autonomous choice. They can choose the hospital or doctors or the way of even the treatment, and they can decide whether to follow to go for the treatment, or they can neglect even the treatment. That is their rights, and they are to be informed. Means the condition of the patient should be informed from the physician doctor's side very clearly, and to receive the health education. Means the situation or the current prognosis of the patient should be very clearly informed to the patient, and how to handle the situation. So that also should be said to the patient from the doctor's side. And they have to get privacy. Means if the patient is feeling to get treated in privately, it has to be accepted and followed, and they have to maintain the dignity. Means the physician has to maintain the dignity of the patient, and the same from patient side also. Next, coming to the principles of medical ethics. So main 5 principles are the autonomy, or the liberty or freedom, beneficence, confidentiality, and do no harm or non-maleficence, and social responsibilities. So when you come to the autonomy or liberty or the freedom, means it is the right of the patient for self-determination. So it is actually entitled to have the control of their own destiny, or to be treated dignified and everything. It is a right of the patient. So it should not be interrupted. So next, for decision, so the patient should be given freedom to think and to take a decision or action about regarding their healthcare procedures, what will be done from the treatment side, everything should be explained to him, and they have the rights to decide whether he needs it or not. Means, even if it is necessary, if a patient is saying, I don't want to take up the procedure, it has to be followed. Next is the freedom to influence the course of treatment. So all the risks and benefits of the procedure and the success rate of the procedure should be explained clearly and completely to the patients. Means if a patient is about to get an surgery, if there is only 20-80 chances, means only 20% chance is there for a patient to survive, particularly when you go for like humeral damages, and when the procedure success rate is very much less, that has to be informed very duly and clearly to the patient. And it is the risk of the patient, that 80% is the risk of the patient, whether to undergo the surgery or to avoid the surgery. And free and informed consent means we have to get, after informing all this situations about the risks and benefits and the procedures and success rate and everything, that has to be documented, and we have to get the consent from the patient side. So only if the patient is ready to consent, the physicians are allowed to go for the procedures. If not, they won't proceed. Next is free will and accord. So means based upon their will and wish, their the patients are allowed to write the will, um, and the physician, if they are following to follow that, they can take some actions to write the will, even if the patient is in a very worst scenario or in very severity in deathbed. Next is veracity. So that is to be very truthful to the patient. Means only by saying the truth, the patient will get trust the doctor, and they will be faithful for the commitments. So the doctors has to be very much truthful. They, at any point, they should not lose that, the patient should not lose the faith in the doctor. They have to trust them completely. Only then they will be heartfully they will be accepting for the procedures. Next one is beneficence. So that is for goodness or doing good. So as it is a social service, our medical field is totally a social service. So whatever the doctor decides, so that should be ending up in the good of the patient. So that is very much important. So the responsibilities of this doctor is to relieve the suffering or to maintain the function of any organs or to restore the health of the patient or to save the life of the patient. That is the main responsibility of the doctor. And the practitioner should act only with the best interest of the patient, provided the patient should believe that whatever the procedures or the treatments are given by the doctor is intended only for doing good to the patient. So that belief, that trust should be there. Next is to provide the ongoing care, means it should be explained to the patient, and the ongoing care should not be stopped at any situations or any personal, because of any personal interest. And the physician should not engage in any activities when the patient is not interested in that. When the patient is not interested in any means like to follow up with the procedures or any minor surgical treatments, if the patient is not interested, he should not be forced by the doctor, and they have to avoid it. And whatever decisions are taken by the doctor, it should do only for the benefit of the patient. So it should end up in the benefit of the, or the benefit of the health of the patient. So the patient welfare must be the first and foremost choice or consideration of the doctor, and it should not be changed. And this beneficence, so this goodness, has a lot of constraints, means a lot of controls and issues in order to follow that. So that is nothing but to it should not be, the autonomy should not be affected by this beneficiaries. Means the physicians or the doctor has to need to respect the patient's liberty. Means he should not force them to do anything, even if it is for goodness. So that may cause some other effects. And the physician should ensure the health, that it is not for the good price, and it is only for only under the good treatment. And it has to be it need to be considered for the right of others also. So it is a doctor's duty to explain that to the patient and to convince them for the goodness of the patient. Next is the confidentiality. So it is totally based upon the trust of the patient to the doctor. So the doctor has to maintain the information very confidentially, and all the personal or medical or the treatment information should be maintained confidentially, and it should be relieved only with the consent of the patient when it is required, either legally or ethically. So like in any other criminal proceedings or civil proceedings, just in case if it is required by the government or the state of laws, that can be revealed there, but that also should be with the consent of the patient. And the data means when the state of the law or any other criminal proceedings are requesting for the data, the doctors should disclose only the data what they need. They should not disclose beyond what is required, not even extra explanation or a treatment or any consideration also should be disclosed there to any other persons. So they have to disclose only what is required, even if it is requested from the government or the state of law. Next one is non-maleficence. So means it is the principle of medical ethic that this profession is holiness. It is only to the only to save a life. This profession is totally important only to safeguard a life of the patient, or to treat the patient, or to improve the health condition of the patient, and it is not for doing any harm to any other persons. And the patient should be informed about the risks and the risk benefits. So that is given as calculated risk or risk benefits, where the patient should be given, as we discussed already about, if surgery is giving only 20% of probability to get survived, or 80% of negative percentage is there, it has to be informed to the patient. And just in case if the patient is lucky to get into that 20%, so that risk benefit also should be explained. So the patient can completely get cured if he gets into that 20%. So that risk benefits and the calculated risk should be informed to the patient only for their knowledge, not to do any harm. And the physician has to make sure that the procedure, whatever he is doing, it won't harm the patient, or it won't harm any other persons in that family or life. Like any other surgeries for a removal of an organ, for example, if there is a transplantation of liver, so it should not means a donor and the organ donor and receiver both should be informed about the current situation, and the donor should be not being affected because of removing a part of their organ. So the procedure what the doctor is doing should not do harm for any other persons in order to save the patient's life. It should not affect the society. So next is doing equity and justice to all, and it is a social responsibility for all the physicians. So the whatever actions that is taken by the physician, it should be very much transparent to everybody. It should be accountable and it should be consistent. Means transparent to everybody means whatever action he is doing, it should be visible or known to all the persons whenever they want to see the history, and it should be accountable means only if it is necessary the person should go for the treatment of particular surgery, or the doctor should give a particular drug only if it is necessary, only if it is accountable, and it should be consistent means it should be stable. The treatment should be in the same manner means if the doctor is means if the doctor is preferring that this kind of drug will do good for treating, they can follow the procedure, but it should not be changed in after 2 to 3 weeks or months for any other reason. So if a physician decides to follow up any way of treatment, that should be consistent throughout the end of the treatment, and he should not discriminate the patient based upon the age or gender or any religion or any their socioeconomic situations or any designations or whatever it is. Or he has to treat all the patient as one. They should not be discriminated by any other means, and the procedures or the actions or the treatment whatever done by the doctors should respect of the law means what all the proceedings he are doing, it should be under the law. He should not violate any law for any reasons. So the last one is about the distribution of burdens and benefits means if two persons need the same kind of treatment and there is a shortage of any drug or any instruments or whatever it is, the doctor is supposed to go for a choice based upon the fair and equal distribution of the resources means he has to decide who needs the treatment immediately. So it should be the treatment should be distributed equally and to all the persons in the society by same means, and he has to decide when the same person, when two or more persons are requiring same medicine and there is a shortage in medicine, he must handle the situation that which person will be needing it immediately and which can be postponed for a while, for which person it can be postponed for a while so that it won't harm their health for time being. So that equality should be there, equity should be there from the physician side. The next one is ethical codes. Means this medical ethics, all the rules and regulations. This codes are nothing but the rules and regulations. So these ethical codes are being described at many situations, and from the 5th century up to this 2020, there was always a revision about the rules and regulations and the codes which has to be followed by the physician. So we'll see all these codes which are most important, which has totally changed the situation of the profession of the physicians. The first one is Hippocratic Oath. So it was from 5th century. So it was the earliest code or the document in the medical ethics. So traditionally, all the doctors, they will be reciting this oath when they are swearing in after completing their degrees. So it is considered as very sacred for the religious foundation and for sanctity. So next one is Nuremberg Code. So it was given at 1948. So that gave a set of principles about ethical research in human experimentation. Means when this medical profession decided to do some experimentation on like human volunteers or in patients, so they created this ethical rules that was in 1948. So that was named as Nuremberg Code. Next is Declaration of Geneva. So this was very much important and notable one. That was also in 1948. So that gave actually the physician oath. declaration. At the Declaration of Geneva only, the oath of physicians were framed, coined, and it was available from the World Medical Association. So it responds to the participation of the physicians in the crimes against the humanity. So that gave a list of rules. So that will be displayed in next one. Next slide means, so this is the pledge or the oath by the physician. So after, when they are getting into the practice, so they have to recite this oath and they have to follow this oath. And this is one of the important medical ethic which has to be followed by the physicians, and this will include almost all the rules in ethical medical ethics. So this was done at the Declaration of Geneva. This was coined at the Declaration of Geneva. So next one is Universal Declaration for Human Rights. So this was also in 1948. Actually, it was considered as a milestone document in the history of human rights. So it was drafted, it was coined by a set of representatives belonging to the legal and cultural backgrounds from almost all the religions in the world. And this declaration was proclaimed in United Nations Assembly in 1945. And it was almost translated into 500 languages throughout the world, and it is being followed by all the physicians. So next one is Helsinki's Declaration. So that is a set of principle. Again, it was against the human experimentation, which was developed in 1964. So already we have seen, so that was in Nuremberg Code. So that was also against the human experimentation, and the Helsinki's Declaration is also again regarding the human experimentation. Almost more than 5 to 6 revisions are made, and the recent revision was done at 2013, I guess, about this Helsinki's Declaration. Next is International Code for Medical Ethics. So that was framed and drafted by World Medical Association. This rule will be applicable to the physicians both in normal peace and in war situations also. So that will be explaining the general duties of the physician and the duties of the physician with patients and along with also with the other colleagues. The last code was Indian Medical Regulation, Council regulations. So this will relate to the Indian Medical Council, and it was framed in 2002, and it was revised recently in 2010, I guess. I'm not sure about it, sorry. And it was revised lately. Based upon the needs, the Medical Council is revising it again and again. So next one is ethics in the research. So when a physician is deciding to go for a research in some disease conditions, obviously they have to use a patient. So and it should not affect the mental and physical health of the patient. So they have coined some rules. So that is about the social value of the social value of the patient and physicians, and the validity and the consent. So when you go to the social value, this study, if a physician is proposing a research work, he should prove that the study should determine how to improve the people's health or the well-being. So that is the first thing the physician has to propose about his research. So next is about the usefulness of the topic or the health research, what he was intended to do. So that research should be expected to produce some needful research, and it should increase the knowledge of others also, and physician has to prove the same. So next is the consent. So consent, obviously, we need to get it from the patients, because the research will be done only with the patients and human volunteers. So those patients, like who are already affected by the disease, and the human volunteers, they must be capable of doing that, means undergoing that research, and they must be given full knowledge about the research what they are doing, and they must understand what the researchers are telling, and they should accept it voluntarily, and they should be treated respectfully. So all this will be included in the informed consent. And these three are the most preferable rule in the ethics of research when a physician is undergoing a research. So next is the codes of conduct. Codes means the rules, obviously. So it is the expected principles that should be considered by any persons, either the physician or any member of the particular group. And there were many codes of conduct were given, have been recited and framed by our ancestors. So the first recorded code of conduct is Atreya Anushasana, and next one is at 600 BC, that was Chakra Samhita. Means it is mainly for the would-be physicians. Means the students, even the medical students, should follow those codes and rules, and they should not violate it. And the next one is Sushruta Samhita. So that is main the rules and regulations for the surgeons and the procedures, surgical procedures which are being given for the patients. The last one is the misconduct. Means in case if the physician is not following any one of the medical ethics, so that is considered as the misconduct. And what all at what situations the physicians are considered as a misconducted physicians are: if he is disrespecting the regulations, means he is ignoring the regulations, or if he is violating the regulations or rules, then that is a misconduct. And he should not involve in any improper conduct or adultery or any threatening interferences with the patients. And next is if he is being sentenced for any other criminal activity against the law, and if he is convicted as a guilty person, then that is a kind of misconduct where the law will not allow him to practice anymore. And next is gender determination test. So this we know it means when in the pregnancy stage the parents are not allowed to know about the gender of the baby, so that may in back days it caused a lot of issues, so that was amended as a law that it should not be disclosed to the parents, so that will be considered as a misconduct if the physician is disclosing it. And the last one is if the physician is signing any certificates or reports or any other documents in terms by knowing that all the data in that is a false, then that is conducted as a violating the law, and it is also considered as a misconduct. And the council or the court can punish them accordingly. So, what kind of punishments will be given if the doctor is violating the law, or if they are considered as a misconducting person? So, first, the complaint will be heard by the medical council, and there will be a team of members in the medical council, and they will be hearing the complaint, and they will give an opportunity to the physician to explain himself from his side. And if he was able to prove, or if he can able to prove that it was done without his knowledge, then all will be that has to be given in a written document to the council. Then the council will take the decision within 6 months. It has to take the decision within 6 months. And based upon the case, the council will give him a decision whether to continue the practice or either to cancel or to restrain or anything. During that 6 months, during that pendency time of the complaint, the council is having the rights to restrain the physician from doing the practice until the decision is announced by the council. So the punishment, the final punishment may include warning to the doctor, or it may be to the official action like reprimand, or they can cancel the registration either permanently or temporarily based upon the violation what he did. So that's it with the medical ethics. Any doubts? If you have any doubts, please tell me, or you can give in the chat box. I hope you all understood the principles and ethics. Members, if you have any doubts, please, you can ask me. Reference material for studying. That will be given in your syllabus, right? I even prepared based upon the reference material which is given in your syllabus. You can follow the books which are in the syllabus, and you all know that only up to 12th standard we can follow one book for a subject. When you after coming to college, and obviously you are in MBA now, and you can't go for any one book for it. You have to refer to or more books when you want to gain more knowledge, obviously, and you can follow the syllabus books. That is very nice and clear. For PPT, I will give the PPTs to the coordinators for sure, and you can ask them. And I don't know in which way they are going to send you. Please, you can contact your coordinators for PPT. I will share today's and yesterday's PPT. Totally 4 is there. Any other questions and any other clarifications if you need, please let me know. So in that case, can I decide that you understood my lecture very clearly?
Yes, ma'am, it's clear.
Yeah, thank you so much for your response. Again, I repeat, if you have any doubts, please ask me, or you can put in chat box. If not, we can finish the session for now. Yeah, I hope no other doubts are there. Thank you so much for your patience, for believing and you're listening to my lecture. Thank you all.
Thank you, ma'am.
Thank you.